Florida, Croeso I Cyfarfod Bwrdd Iechyd. On behalf of the board, may I welcome you all to today's meeting of the Health Board. The first part of our agenda is our annual trustees meeting. And before we move on to talk about the items on the trustees meeting, I'll ask our interpreter, Larry, to explain to attendees how the interpretation system works, and then Klinos will switch the interpretation on. Larry.
In a minute, the translation will be switched on, and once it's switched on, a globe will appear, normally at the bottom of your screen near where it says participants and share screen. But if you're using a tablet, it could be on the top right-hand corner under the 3 dots, and you'll need to click on those. So you need to look for the interpretation globe. You then need to select English. You may also have to press done at the end. So Llinos, if you could switch on the translation and we'll see if it's working. Diolch yn fawr.
Okay for me.
Yeah, that seems fine, Larry. Okay, so without further ado, we'll move into the agenda for the trustees meeting. And the first item is the minutes from the previous meeting held on the 23rd of January. Is everybody happy with the accuracy of the minutes, first of all?
Yes.
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 Thank you. Okay, so no actions were agreed at that meeting. Kirsty, can you confirm all of the actions have been discharged, please?
Yes, I can, Mark. Thank you. Thank you, Chair.
And Jackie, as the chair, are you happy that they have been?
Yes, I am. Thank you, Mark.
Thank you. Okay, so we move on to the second item, which is the annual report and accounts. I've got Rebecca, a senior accountant, listed for this item. Rebecca?
Yes, thank you, Chair. For those that don't know me, my name is Rebecca Hughes. I'm the charity accountant. Today I'm going to be just covering the 2019-20 annual report and accounts for the charity. And then my colleagues Kirsty Thompson and Emma Jones will go on to talk about the impact of the charity over the last 10 years and the strategy moving forward. So just to recap, and for those members who may be new to the charity, Our Lass is the Health Board charity. It's formally registered with the Charity Commission, and the board of BCU is the corporate trustee. These accounts and annual report are therefore brought to you as the corporate trustee for your assurance. Following external audit by Audit Wales, they were approved and signed by the Charitable Funds Committee in December, using its delegated authority, and then they were submitted to the Charity Commission in January in accordance with the required deadlines. So just really briefly, in 2019-20, the charity received income of 2.6 million, and that came from donations, legacies, fundraising and investments. Expenditure on grants and the running cost of the charity was 2.5 million, and there was a loss in investments of 0.3 million. That loss was due to the impact of COVID, and I'm pleased to say that since then, all of that loss has been recovered. I'm not going to go into any detail about the accounts. There is a paper in the board papers that summarises some of the key elements. I'm obviously happy to answer any questions that you may have. And then I'd hand over to Kirsty and Emma to take you through the rest of the agenda. Thank you.
Rebecca, I can see that John Cunser has got his hand up.
Sorry, John.
Thanks, Rebecca. One small inaccuracy in the annual report. You spelt my name wrong on page 60 or 61.
Okay, apologies about that. We'll make sure that's corrected and changed. So please accept apologies about that.
Cheers.
Any other questions or observations?
No.
Okay, so we are asked to receive the annual report and accounts. Is everybody happy to do so?
Yes.
Yes.
Okay.
Yes.
So thank you, Rebecca, and
Yes.
for all the work that's gone into preparing the report, and of course also in dealing with the finances of the charity. So we support the reception of the accounts. Thank you very much.
Thank you very much, everyone. So I'll hand over now to my colleagues Kirsty and Emma, who will take you through the next part of the agenda.
Thank you.
Thank you very much indeed, Rebecca. I'm going to share my screen now so that everybody should be able to see it. I'll share it now. Is everybody able to see my screen?
Yes.
Excellent. Okay. Okay, thank you. So we're moving on to the 10-year impact and COVID-19 update presentation. Firstly, I'd just like to start by saying thank you for having us all here today. Many of you do already know me, Kirsty Thompson, Head of Fundraising, and we're joined by our colleague, Fundraising Manager Emma Jones, as Rebecca has already said. And Emma oversees digital and data systems for the charity. You have received the 10-year impact report and a COVID-19 update from earlier on this year. So the presentation that we'll be sharing today brings you up to speed on the latest developments with the COVID-19 response fund. So as many of you will have seen, staff members that have benefited from the COVID response fund have shared their stories recently and over the past year on GMTV and the ITV News, on a national Marks and Spencer's campaign, and in national newspapers. Our Last will also be featuring on the Lorraine Show over the next fortnight. 15 different staff members have provided us with content for that. And some of you will have also seen that Dan Menzies, the respiratory consultant in Ysbyty Glan Clwyd, was selected to speak with the Duke of Cambridge earlier this week, following all the work that he's done with setting up a COVID-19 fellowship, medical fellowship for funding from Our Last. Before we begin, I'd like to take this opportunity to thank everyone who supported the COVID-19 response appeal fund and all our other funds throughout the year. From 9-year-old Amy, who set up a wishing well outside her house during the first lockdown, to the communities who organised socially distanced village bingo last spring, the sports teams that organised online games to raise money for local businesses, with local businesses, and local businesses and national foundations that have also given over the past year. In addition, I'd like to thank the third sector groups that support BCUHB directly with donations, the Leagues of Friends, Mailer Voluntary Service, and a host of others. These charities and their staff and volunteers, like everyone, have been hugely affected by COVID-19, especially those that have not been able to open their cafes and shops on BCUHB premises. Nevertheless, their passion and commitment to BCUHB's patients, staff, and services has not waned. Lastly, thousands of people and businesses have supported BCUHB voluntarily over the past year, offering additional transport, their time, accommodation, PPE, and other items that have made a huge difference to colleagues. This support is not included in this presentation, but I feel that or we all feel, I'm sure, that it deserves to be acknowledged here. I'll now pass over to Emma, who will lead this presentation from here, and perhaps we could take questions at the end of the next presentation, if that's okay. So thank you. Over to you, Emma.
Thank you, Kirsty. Emma Jones here, Fundraising Manager, part of the Our Last support team. So over the past decade, patients and staff have seen significant improvements made to their hospitals and community services as a result of the £28 million that Our Last has invested in enhanced and additional services, facilities, equipment, resources, research and education. Next, Kirsty. Thank you. The Awyd Last COVID-19 Appeal Fund, which was launched in March 2020, has given grants of over £400,000 to date, supporting additional equipment and facilities, special projects and extra training. 48% of the Awyd Last COVID-19 grants given to date have been made possible thanks to donations given directly by local people and communities. The remaining 52% of the charity's COVID-19 grants have been funded through NHS Charities Together funding. NHS Charities Together is the umbrella charity for 241 NHS charities across the UK. It has raised over £150 million through its urgent COVID-19 appeal, which has and will be distributed to its members. There are 3 stages of grants from NHS Charities Together through the COVID-19 appeal. Stage 1 had a focus on the urgent and immediate response to COVID-19. This is funding that we've already received. Funding was allocated in different tranches. Some tranche amounts were based on the number of staff members within a health board or trust. Others were based on the size of the population served by a health board or trust. Stage 2 focuses on strategic partnership and community support. Awyd Last worked in partnership with the Wales Council for Voluntary Action, WCVA, back in May 2020 to facilitate a workshop and produce a report. And that was to help identify the challenges facing the communities in North Wales and the needs of the local population as reported by Welsh third sector groups. Now, this important piece of work has informed decision-making for the priorities for this second round of funding. And stage 3 will support longer-term COVID-19 recovery and resilience programmes, including staff wellbeing and capital improvements. NHS Charities Together has designated almost £5 million for Wales, and Awyd Last will receive a total of £912,000 from the national NHS Charities Together. Grants from the Awyd Last COVID-19 Fund go over and above what BCHB has provided since March 2020. The grants given to date have helped make a real difference for patients and staff in a variety of ways. Some examples of what staff have requested funding for include additional bereavement and carers support services, digital devices to enable virtual visiting, specialist neurophysio equipment, extra ECG machines and blood pressure monitors, so some patients can be monitored more effectively at home, equipment for practice development nurses who are providing training to care home staff and redeployed staff. Other examples include hot cots and Zaki hugs, which are special paediatric bolsters that help ensure babies in the special care baby unit and children that are separated from their families can still have the comfort and closeness of a parent's loving touch, and a staff wellbeing support service and emotional resilience training for BCHB staff members. All the programmes that have been funded vary dramatically, from arts therapy for patients and arts programmes for staff, to hubs in the home for patients under the care of the chronic pain management team, a COVID-19 medical education fellowship, a COVID simulation suite, and a virtual hospital scoping project. So many invaluable extra services and support sources have been made possible thanks to the donations Awyd Last has received for the COVID-19 fund. Now here we've applied broad descriptions to give a breakdown of the grant funding that has been allocated to date. You can see that, sorry, we won the last slide there, Kirsty, can we go back one? There we go. So yeah, 34% of the expenditure has been on extra equipment. Sorry, I'm back again, Kirsty, next one. And here again, we've used broad descriptions again to show the services that have benefited from the COVID-19 fund, just to give you and supporters an overview of how donations have made a big difference to a huge breadth of patients during the pandemic. Thank you.
Thank you very much indeed for that, Emma. I'm going to move, if it's okay with everybody, I will move straight to the next presentation, and then we can take questions at the end if that's okay with everyone. I'll just pull up the next presentation here. And can you all still see my my screen? Yes, I'm assuming that you can. Yeah. Excellent. Thank you, Chair. Okay, I just wanted to use this opportunity to summarise some of the work that we've been doing on drawing up a new 4-year charity strategy. And then, as I say, we'll be able to take some questions at the end because we should have time for that. Obviously, we always need to look back to look forward. So over the past few months, we've been considering whether we met the 2016 to 2021 charity strategies intended aims. The main focus of the charity was to increase awareness of giving to our healthcare services. Did we meet this aim? Partially, but we didn't increase staff understanding of the charity to the extent that we planned to. And we didn't receive the increased levels of external support that we'd intended to. So we did see an increase in awareness, but not to the levels that we would have liked to have seen. The 2016-2021 strategy had laid out objectives to launch 4 focused campaigns on older people, early years, cancer care and mental health. This too was not carried out fully. Small fundraising appeals in those areas were successful, but no large-scale appeals were launched. We called upon the services of Yellow Chair Consulting, which has experience of developing strategies for other NHS charities, as well as NHS trusts and other organisations. So we called upon their services to help us identify why key objectives had not been sufficiently met and to carry out a benchmarking exercise against other NHS charities. NHS charities in the main are in a very different place than they were 5 years ago. Many have invested in developing marketing, fundraising and volunteer programmes. And with NHS Charities Together now committing to increase the profile of NHS charities nationally, there are big opportunities for all NHS charities. The Awilaa support team has carried out 4 workshops in the past 6 months, and we've drafted a strategy framework. We've still got much more work to do on that, and we're issuing a staff survey over the next 2 weeks, which will further inform the development of the new strategy. All board members are invited to contribute to the development and delivery of your charity strategy. Early next week, I'll circulate a board member survey for you to complete in the next 3 weeks. The 2021-25 strategy can then be finalised at the June Charitable Funds Committee. The committee met earlier this week and members expressed a wish to focus support on children and young people, and also on our COVID resilience and recovery programmes moving forward. We're keen to get everybody in this room's, or I say room, in this virtual room's views on what the strategic priorities should be between now and 2025, and how, and get your opinions on how we'll work together to achieve the aims and objectives that we all set for the charity. So I do hope you'll be able to complete the survey that we share with you next week. And I'd just like to thank you and also declare an interest, which I should have done at the beginning of the meeting, which is that I'm Deputy Chair of NHS Charities Together. Thank you very much indeed. That ends the presentation, so I'll stop sharing and can take any questions. And thank you very much, Chair.
Thanks, Kirsty, and thanks, team. Jackie, as Chair of the Charitable Funds Committee, do you want to comment first?
Yes, thank you, Mark. Really, my comment is to give our thanks in public to Kirsty and the team for all the exceptional work they've done over the last 12 months. It's been truly appreciated, both within the community and within the organisation. It's been a difficult year, we all know that, but the team have adapted and moved forward in a very impressive way, shall we say, and hopefully we can carry on with the same thing. And just to add to Kirsty's plea, it would be fantastic if as many people as possible could complete the questionnaire, and we may well be seeking volunteers for some further work in a couple of months as well. So thank you all so much to the team, and if Kirsty could pass that on, and Rebecca, if you could pass it on to the finance team as well, that would be fantastic. I'm sure Kirsty will be happy to take some questions now. Thank you.
Thank you, Jackie.
So I don't see any hands raised, but can I ask, are there any questions that people want to pose or observations to be made? No? Okay. Kirsty, can I echo first of all what Jackie's just said on behalf of the board? Can I ask you in terms of what you believe might be the impact of income falling, which was noted in the financial report, particularly in terms of interest, and we know what's happening at the moment in terms of the financial market, whether that is a concern to you and your team, and if so, what we might do to mitigate that concern. And secondly, whilst acknowledging we will all want to complete the survey, is there anything else that the board can do to assist you and your team in the work and activities of the charity?
Thank you, Mark, for those questions. So firstly, yes, we are concerned about a drop in income. And the concerns are around the fact that our wards and departments, many of them rely on donations to add those the extras that can make a real difference, as we all know. And what we've seen over the past 12 months is that whilst we've had huge support, fantastic support for our COVID response, we've seen a huge decline in donations to those wards and departments. We reported at the Charitable Funds Committee earlier this week a 51% decline in donations to specific wards and departments. So in terms of what we want to do about this and what we've been looking at in terms of doing this is to look at new and different income streams. So there are, for example, trusts and foundations who we have not previously invested time in approaching. So that is one area that we'd really like to expand our work on. Another area that we'd like to expand, whilst we have greatly increased, particularly since Emma's come to the team over the past 2 years, we've greatly expanded our profile on digital platforms, on social media, and also within the press. But there's significantly more work that we could be doing on there with that as well, Chair. So they're two areas that we're really looking at. And as well, I think it's going back to looking at where we weren't 100% successful in our previous strategy, which was around raising awareness with staff. So we need to put a lot more effort into making sure that staff are aware of the charity and aware of their, and I say responsibility loosely, but the responsibility that we all have for promoting our NHS charity. So that takes me to your next question, which currently, since over the past few weeks, since Joe has arrived, we have done more to promote the charity. Thank you to both yourself and Joe for sharing messages about the charity on your weekly updates to all staff. We know that those have increased awareness of the charity already from comments that we've had with staff. I think that we need to do a lot more around increasing the visibility around BCUHB premises, etc. At the moment, that is obviously a challenge because lots of people aren't in our premises. So we are speaking with communications and with others NHS charities to gauge what we can do better about raising our profile. And definitely there's a role to be had by yourselves as board members to encourage all staff to promote giving on their within their wards and within their services. We do have on and around the NHS birthday, we will have the NHS Big Tea, which has been organised for the past 3 years. We'll have a cake competition as well, which has been successful, very successful over the past 3 years. So we are looking to that at the moment, to focus energies on getting people involved. We're very hopeful that that will be a time where certain COVID restrictions will be lifted as well. So it could be a time where we can both reflect and celebrate. So I'd be very grateful if we could ensure that we're all a part of that in the short term. In the longer term, in terms of another way that we will be raising the profile, is to build on the Light Up Christmas campaign that we had over the last Christmas. And we're very hopeful that we can do what other NHS charities did last year with great success, which is to light up in different ways their premises. And so we're looking at that. And as Jackie alluded to earlier, it would be great to be able to have some members of the board being able to be the main links for us to help ensure that that's a huge success across the board. So I hope that answers your questions, Chair.
It does, thank you. And,
Thank you.
feel free via Jackie or directly to nudge Jo and I if there's anything that you want us to help with.
Thank you very much.
Got a hand up, Sue Hill. I suspect it's around the finance point, but we're about to find out. Sue?
Yeah, thanks, Mark. It's just a quick one to say that the loss in the investment has been recovered by the beginning of the new financial year, because the market is that volatile, and that we have just changed the investment management. We had a very interesting presentation by the new investment management team in the charitable funds meeting, and we're happy to share that with the board if anybody's interested.
Thanks, Sue. And finally, Jo.
Thank you, Mark. I just wanted to put on the record my thanks, Kirsty, Rebecca and Emma. It's really lovely to hear about the fantastic work that you've been doing on all of our behalves across the last year. And I know I speak for each and every one of our staff members who really have appreciated the consistent support of the charity during what has been a really difficult year. Thank you all. Diolch yn fawr.
Diolch yn fawr. Thank you very much indeed.
Okay, so that concludes the trustees meeting. Kirsty, thanks again to
Thank
you. Diolch yn fawr iawn. And we'll no doubt see you soon. Thank you.
Diolch. Thank you, Chair. Thank you, everybody.
Okay, I intend that we'll pause now and start the health board meeting at the appointed time of 10:15. So please be ready to resume at that time, and we'll go straight into the health board meeting and the agenda items. Thank you. Okay, Cleos is now going to start sharing the screen. Croissant et al. We are now moving into the Health Board meeting proper. The first item is my introductory remarks, and before I make any further comment, I wish to report that there have been Health Board Chair's actions taken in respect of the following: to allow the Health Board Claims Manager to continue negotiation regarding settlement of a high value claim relating to ophthalmology, to approve recommissioning of general dental health services in Colwyn Bay and Carnarvon by a novation of the existing contract, something I know will be welcomed by the communities in those areas, to approve procurement, haematology and coagulation managed service contract, and finally to approve business justification case for cancer services CT simulator. So they have all been dealt with by way of Chair's action since the last meeting. I just want to add, by way of introduction, that I think we need to spend some time today on the COVID-19 update, and particularly on the outbreak at Ysbyty Gwynedd, given the level of concern that exists in our communities and across the board as well. So that is my intention, and I will also wish to discuss the outbreak in private in the in-committee session at the end of the public meeting. So, Joe, over to you. The next item is your CEO report.
Diolch yn fawr, Mark. I will take the Chief Executive report as well as read. However, I would like to express my ongoing thanks to staff and partners of BC UHB with regard to our ongoing efforts in managing the COVID-19 pandemic. And I would also like to extend my thanks to those staff members who have kindly hosted me during my Get to Know You visits and to get to know the North Wales geography visits during my first few weeks here at Betsy. My commitment to continuing to take time to visit all of our areas continues with visits to the Llyn and Blaenau tomorrow. I'm very happy to take any questions on any of the detail in my Chief Exec's update. It is the first Chief Exec update I have done for this board, and I'd be very happy to take any feedback on the content. Thank you.
I do think it's a useful addition to the agenda, Joe, so thank you for that. Any questions or observations for Joe? No? Okay, so we'll move on to apologies for absence. Kate, any apologies for absence noted?
No, there were no formal apologies received.
Thank you. So any declarations of interest to be declared?
I've got one, Mark, against the Sports North Wales items, item 4.2, because ADRA, the organisation I work for, is also a signatory to that agreement.
Okay, so that is noted, Frank. Did you want to leave the meeting for that item then, when we come to it?
I think it's probably wise that I do, Mark.
Okay, thank you. Any other declarations of interest? Avion?
Ga inna hefyd, Mr Cadeirydd, datgan diddordeb ar yr item 4.2. Dwi'n hefyd yn aelod o bwrdd ADRA, a bydd angen I fi adael y cyfarfod mewn byr debyg.
Chairman, it's Cheryl Carlisle here. I will also declare an interest in that same item because Conway Council hosts that, so I will leave at that point as well. Thank you.
Okay, diolch. Medwyn?
Diolch yn fawr iawn, Cadeirydd. Am yr un rheswm a cynghorydd Cheryl Carlisle, fyddai'n angofod dangos diddordeb oherwydd bod fi'n aelod lleol o Cyngor Gwynedd.
Okay, iawn. So you four will leave the meeting temporarily for that item. Thank you. So we move on to the minutes of the Health Board meeting held on the 21st of January. Any comments on the accuracy of the minutes, first of all? No? Okay, so we'll then move on to the open actions. Adrian, the first action was with you. It indicates that a paper is scheduled to be reviewed at the April Strategic Partnerships and Population Health Committee. Is that correct?
That's correct, Chair, yes.
Okay, thank you. So we'll close that action from here, and if it needs to return, I'm sure either you or the chair of SPPH, Lynn, will pick it up and let us know.
Will do, thank you.
The second open item was with Gavin and relates to the interim head of Plan Care advising the original briefing note had been superseded by later papers. I think that is absolutely the case, because since the last board meeting, Finance and Performance Committee, which you know I chair, has received updates in terms of Plan Care. So I'm happy, if others are, to discharge that action from this list. And then finally, and we have an open action, Teresa, in respect of your good self, which is in relation to a task and fringe group being in place and being chaired by you, involving local authority partners, and a draft plan being in development. Do you want to tell us where you are, Teresa, in terms of that item?
Diolch iawn, Cadeirydd. Yndan, da ni wedi cytuno fydd yna grŵp tasg mwyn symud hwn ymlaen. Mae hwn wedi bod yn eitem dwi'n gwybod sydd wedi achosi cryn pryder i'r aelodau annibynnol. Da ni yn gweithio yn ddiwyg ar cynllun. Da ni wedi penderfynu ar rei gweithredau. Mae yna rei yn genedlaethol, mae yna rei yn mwy lleol, a bydd rhaid ni weithio drwyddyn nhw wedyn y cyfarfod tasg fydd nesaf. A dwi'n ddiolchgar iawn am cymorth Dr Apan ac hefyd Chris ynglyn â'r gwaith, oherwydd mae hwn yn waith sydd yn mynd ar draws y bwrdd iechyd, nid yn unig gwaith i'r adran iechyd meddwl. Diolch yn fawr iawn.
Thanks, Teresa. John, did you want to come in?
Thanks, Mark. It's not on Teresa's point. It's one of the following closed ones.
Yeah, okay. Do you want to come in now then?
All right, thank you. So 3 after Teresa's is one from with Chris's name against it, which was about risks. I'm happy for it to be closed and taken to DIGC, but the concern that was raised was about the fact that a risk had been lost without the full governance process. I just wanted to confirm that when it gets to DIGC, that we're actually going to include the background to decisions and that governance process as it was actually referred to in the minutes.
Okay, thanks, John. Chris?
Yes, Don, I confirm that we will do that.
Thank you.
John, did you have other comments?
No.
Okay, I've got a comment in respect of the action listed as 21.13.2, which rests with you, Mark. The update is the action is the action in respect to the 2 recommendations I raised at the last meeting are now recorded on the team central database. I'm not sure what that means, but it provides me with little by way of assurance, given I don't see that database, and nor does the board. So it would be helpful to receive an update in terms of the recommendations, given the updates were not suggesting the recommendations have been closed and they should have been.
Okay, thank you, Mark. So Team Central is an internal system that we use to track audit, both internal and external recommendations, and to monitor progress. So we all update it as officers, and then progress is overseen by the audit committee. Those actions have been appropriately input and closed off on that system, and my understanding is that that'll be picked up at the next audit committee meeting. But I'm happy to check into that and just clarify that to make sure.
Okay. Louise?
Yeah, Mark's just said what I was going to say, and they are flowing through into the audit committee, which is happening next week. So the audit committee will have that visibility, Mark.
Right, so have they been completed?
Yeah.
Yes.
Okay, all right, thank you. Okay, thanks. No doubt Medwin as chair of audit will look out for them then in that case. So I think that is all of the actions on the table. So are you all content to move on from the action table?
Yes.
Thank you. So we then move on to the committee and advisory group chairs assurance reports, which are items for consent, but I want to afford the chairs an opportunity to highlight anything they may wish by way of exception in terms of their reports. The first one is in relation to the COVID-19 cabinet meeting held on the 4th of February, which I chair. There is nothing I wish to highlight. If you have any questions, let me know now. No, thank you. The second is the the JACS meeting. Medwin, Lucy, anything you wish to highlight?
Yes, please. Just to recognise, I think the clinical audit programme has been cause for concern for the Health Board for a period of time now, a number of years actually, and we were pleased to see that some real progress has been made in relation to that programme. We've still got a lot of work to do, but it was good to see actually much more comprehensive plans coming forward, and the auditors were happy to receive that as well. We also looked at the learning, though, on the back of some of the audits that had been undertaken from the perspective of whether or not the learning had been embedded. I think it's clear that there's more work to do in relation to that, but we have asked for that to be taken away. Thank you.
Thanks, Lucy. John, did you want to comment on that item too?
Yes, please. There's a reference in terms of referring to other committees to DIGC for GDPR requirements under the second wave of COVID. It's not on my DIGC agenda for the next meeting, so don't think I've had those details. I don't know whether it's probably worth a conversation outside or just to get some details from Lucy.
Okay, can you pick that up with Lucy outside?
Yeah, thank you.
So Lucy, can I just be clear? So is the committee as yet cited on the pathway and the timelines for the clinical strategy or not?
No.
Right, okay.
But we have, one of the things we discussed at that committee meeting is because it only meets annually, it's not really the ideal forum. So that needs to be picked up separately through the other governance routes. And in fact, Simon is looking at, as interim director of governance, he's actually looking at the role of JACS going forward. But we do need to pick up the clinical strategy, timescales, timelines, etc., and how that's being taken forward.
Joe, given its reference in this assurance report and highlights the need for a conversation to take place involving me, can we agree we'll pick that up outside?
Yes, very happy to do that, Mark, and just to update all colleagues on the work that is going on at the moment around mapping our current engagement activity, both within the organisation and with our partners, in preparation for the beginning of the conversation with regard to the refresh of living healthier, staying healthy, living well, sorry. I'll remember that one in time, and also the emerging process for the clinical health services plan. Thank you.
You got it right first time around.
Thank you.
Guessed yourself. Okay, so thanks for that, Joe. We then move on to QSC committee. Lucy, anything you want to highlight?
Yes, please, Chair. I just wanted to highlight really that we received a report on the findings of a review that's been undertaken in relation to the Holden report. Board members will recall this is a report that was undertaken a number of years ago, and there have been ongoing concerns about implementation of the actions thereafter. So a review was commissioned internally to basically map out the actions and provide assurance to the committee that those the actions arising from the report had actually been taken on board and embedded. It was the committee accepted basically that a number of the actions had indeed, well, I think it's fair to say probably all of the actions actually had been implemented, but due to the passage of time, some of that learning had then been lost again. And so what the committee then supported a proposal for a strengthened governance process around tracking action plans for all future centrally commissioned reports in order to ensure that the loop is closed then. So although there may be learning initially implemented, making sure that then over the course of time that learning is not then lost going forward. I don't know if Jill wants to add anything to that at all.
It's probably worth adding, Lucy, and it isn't another, it is on the agenda, is that we will also be reflecting this through the mental health element of the maturity matrix in the targeted intervention framework. So I think bringing all these pieces of work together.
Thanks, Jill. I would like to thank actually the team for the huge amount of work that they did with this review to provide a really thorough review of all of the reports, because there were a number of reports that were issued around a similar time, raising a number of similar themes as well. So the review that the committee received included cross-referencing of all the evidence that had been looked at as well, so it can be clearly seen the number of reports and how that's been cross-referenced, and that information of course is available. The reports are available as part of the public papers for the QSE committee.
Thanks, Lucy. So community transmission and YG and YGC outbreaks were referenced, but we'll come on to that. Early on in the report, or relatively early on, you refer to concern about adequate scrutiny being provided by the risk management group, and there's reference to the interim head of governance taking that away. Is that progressive?
Yes, that has progressed. This report refers, of course, to the January committee. We subsequently had a meeting after that. The information that we received then in March was improved, but there is still work to do, and that's been fed back as well. We've had discussions as well with internal audit about getting assurance in relation to the implementation of the risk management strategy to make sure that actually this is a robust process, but there is still clearly a lot of work to do in relation to the risk register as it's being implemented as it is now.
Okay, thanks, Lucy. So we now move on to Finance Performance Committee. My assurance report covers 2 meetings. I've got 8 I wish to highlight. Are there any questions or observations? No? Okay, so we go on to SPPH. Lynn, anything from you?
Thank you, Chair. I would just like to highlight 2 points. Prior to the meeting, we had a workshop which we discussed 21-22 plan, and a lot of that feedback then centred on the agenda itself and has been forwarded to the board for general consideration on the future of the plan. The other area is that, similar to other committees, we were asked to look at the risk appetite, and we would like this to be done on a board-wide basis, especially now that we've got the issues of COVID and how our risk appetite is altering in different areas. Thank you.
Louise, is there anything you want to say by way of response?
Yeah, thanks, Mark. That conversation around risk appetite has been common amongst a number of the committees, I think, in this first cycle where the committees have received their first formal cut of the BAF risks in addition to the corporate risks as well. So using that feedback, we're going to bring that into a board session, probably the one at the end of April, which feels timely given it's the start of the financial year, and that would traditionally be the time where we're looking at realigning the BAF to objectives moving forward, and that will be the time where we can have that board conversation, Lynn, about our risk appetite going forward in the space that we're now in around ongoing COVID management and indeed the recovery as well. So we've got that to come through quite soon.
Thank you.
Lynn, your report also references some observations around reporting and monitoring of cluster plans. Chris, I wonder if you want to comment on that particular point, given I know you've been doing some work with the localities.
Yes, thank you, Chair. So there's a lot of enthusiasm amongst the locality leads, cluster leads as they used to be known, and a lot of really positive work being done in terms of their cluster plans. Last year they were highly commended across Wales, and this year's are of a similar standard, I believe. There is more work underway in terms of how we build that within our existing planning cycle, and more work underway in terms of how we support our cluster leads to not just accept the level at which that work has previously been done, but actually to move it further forward, and in particular bring in some of the partnership planning into that space, so that it's not just focused around our work. So it is work underway. I'm really pleased with where it's going, and we will continue to work with SPPH on that basis.
Okay, thanks. Lena, you content with that?
Yes, absolutely.
Okay, thank you. Your report also asks us to retrospectively note that you approved as a committee the business continuity policy at your December 2020 meeting. So we'll do that now. Thank you.
Thank you. Thank you.
So RAT's assurance report has been provided. I chair that committee too. There's nothing I wish to highlight. Any questions or observations? Right, thank you. We then move on to the next item in terms of the rest of approved clinicians. It was an item for consent. Are colleagues happy to ratify the attached list of additions and removals from the register?
Yes.
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 Thank you. So we'll now move on then to items for discussion. And the first rests with you, Chris, to open, I think, and that's the COVID-19 update.
Thank you, Chair. I'm just going to share my screen now. I'm hoping that you're now seeing the presentation. Could somebody just confirm that?
Yes, Chris.
Yeah, that's great. Thank you. If colleagues are content, my intention is to run at a reasonable pace through the slides, which I think set an overview in terms of a briefing, and then at the end of that, as you've noted, Chair, open up then for the conversation, which respective colleagues will also want to contribute to. On that basis, then, in terms of our prevalence and impact, the first thing I'd want to share with board and members of the public is with regards to community levels. What we've seen since our last board meeting is that the levels of circulating coronavirus here in our North Wales communities has generally and consistently reduced. You will be aware that prior to this, levels were quite high in certain communities within North Wales in particular towards the northeast of Wales. But we're now seeing that levels across North Wales in all of our local authority footprints are now broadly in the same sort of space, which is around 40 cases per 100,000 in the last 7 days. This chart shows then just in the course of the last couple of months how those levels in those areas which were particularly affected, and those would be Flintshire, Wrexham, and to a slightly lesser extent Denbighshire, are clearly reducing. Those localities more westwards, where levels were never as high as they were towards the east, have maintained that position and continued to have comparatively low levels of coronavirus activity out within their communities. And this contrasts to the same data presentation from a couple of months ago, which very clearly shows that the opposite was the case then, and we were on a very high and sharp rise with increasing activity. So this is positive news. and reflects the impact of lockdown. It probably also partly reflects the impact of vaccination now, and it's really important that we maintain those lower levels of community activity as we go forward. What we see when the community levels reduce is a reducing number of presentations to hospitals. It then takes a little while before we start to see the impact in terms of inpatient care reduce, because some individuals admitted with coronavirus have very complex problems and sometimes result in quite significant hospital stays. What you'll see from this chart, and the first chart is admissions into Ysbyty Gwynedd, the centre Ysbyty Gwant Clwyd, and in the east, the Myla. You can see that over the course of the last 4 weeks or so on all sites, our admissions from coronavirus have decreased. In terms of where our inpatients are currently residing in North Wales, the majority of our inpatients now, or at least the largest section, lie in our community hospitals and the community hospitals across North Wales, with a lower number of individuals now in the Myla. And as you may recall from the last board meeting, that dark blue section representing the Myla was a much more significant piece of the pie chart compared to now, and that is positive. You will, however, note that the lighter blue section, which is Ysbyty Gwynedd, has increased significantly. That relates to the hospital outbreak that has already been referred to, and that we will go on to discuss in greater detail. That outbreak occurred in late February in Ysbyty Gwynedd, and resulted in an increase in inpatients being managed with COVID-19 in late February and through to the present time. As a consequence, there have been a range of outbreak interventions that have now been put into place in keeping with the management of coronavirus hospital outbreaks. They're being closely monitored, and we are seeing a decrease in hospital associated coronavirus in YG now as a consequence to that. In support of that, we have secured additional IPC, which is infection prevention control expertise and capacity, and additional support in terms of senior nursing leadership in particular, on the Bangor site to help us manage the outbreak. I think it is important to draw out human factors and the role that human factors has to play within this, and therefore within our response. It in absolutely no way diminishes the significance or the importance of a hospital outbreak. I don't want anybody to interpret my wording as suggesting that. But it is important for us to recognise that as pandemics progress, as people become tired, as people have conflicting priorities in terms of trying to do the right thing for those individuals without COVID as well as those with COVID, as people within our communities stop following some of the behavioural interventions that have been recommended quite so consistently, then human factors come into play. And so we're adopting an approach which looks at some of those factors to ensure that we are addressing them. And it's really important in terms of turning some of this around. That will ensure then that we are in a position on the YG site of making sure that the best practice that has historically been in place on that site continues to be in place on that site, and also importantly that we're checking the same human factors approach on other sites to be absolutely clear that the good practice that has been followed remains in place, and that people absolutely understand that, for example, with vaccination or with decreasing levels within the community, we absolutely must still follow the processes that have been put into place for very good reason. Alongside this, we've commissioned an external review of the outbreak in Ysbyty Gwynedd, and that has now been secured and commences this week. And alongside that, we'll bring the outbreak reporting to the next board meeting and to intervening board cabinet meetings to ensure that we are providing updates as we work through those plans and that review. I'm going to move on, recognising that we will come back to that. In terms of workforce, as people will fully understand, coronavirus also affects our frontline healthcare workers, and we are aware that healthcare workers have got a higher rate of developing coronavirus as a consequence. What we're now seeing as community levels are reducing is that we're experiencing a reducing level of coronavirus with our staff too. The first chart, the chart on the left there, shows the number of positive cases amongst our staff coming down very nicely, as expected and as hoped. The chart on the right shows overall staff sickness and absence levels. In terms of the operational impact of recent second wave pandemic presentations, we are now in a position with decreasing activity from COVID on the Wrexham Miler site to carefully reintroduce some of the activity that was suspended on that site, and the team are working through that to ensure that that is brought back on stream in a controlled and safe way. Because of the amount of activity that we are seeing from coronavirus on the Ysbyty Gwynedd site, we have at present temporarily suspended some planned activity on that site, and are adopting the same triaging approach that we had in place when the same situation required a reduction of activity over in Wrexham. And as the activity subsides, we'll be seeking to reintroduce that activity in the same way that we are now that community levels have reduced in Wrexham and Flintshire. As you would have hoped, we are starting to see a decreasing amount of activity within our critical care environments as a consequence of COVID, and that's very warmly welcomed. It's fair to say that those facilities are still very busy, but nonetheless we have less individuals in North Wales now requiring critical care intervention, and that absolutely has to be a positive thing. Moving through to TTP, which as you'll be aware is Test, Trace and Protect. We continue to have sufficient community testing capacity in place in North Wales for us to be able to test people quickly where that is required. The lateral flow testing programme for our NHS staff continues and develops, so that remains part of our arsenal against coronavirus. In terms of tracing contacts, 2 points I think I want to share with you. The first is that whilst we have a reduced number of positive contacts to trace, we are starting to see a slight increase in some areas of contacts that those people have been in contact with. We're monitoring that very carefully and very closely. It is of potential concern, but at the moment is one to take a watching brief upon. The second part I think I want to share is that we are now backwards tracing as well as forwards tracing here in North Wales. Now, forwards tracing is where we identify somebody with coronavirus and then seek to identify any people they may have passed coronavirus on to. Backwards tracing is where we identify somebody with coronavirus and then try to work backwards to identify who they may have got their coronavirus from, and then trace from that person to. It requires more work. It requires going back for a further number of days, but it is demonstrated to have an impact within coronavirus, and it is something that now the numbers are decreasing, we have more capacity to be able to do. So that is positive news. In terms of vaccination, as of the beginning of this week, we had given just over 270,000 coronavirus vaccines here in North Wales. That number stands at 285,000 as of yesterday. We continue to use Pfizer and AstraZeneca vaccines. Within that number, there is around 50,000 as of yesterday individuals who've received their second dose of vaccine. We informed board previously that there was a planned reduction in vaccine supply arising from the manufacturers changing their production lines to allow them to make greater quantities. We've accommodated that during mid-February as it occurred, and we're now anticipating that increase in supply quantity that we've started to see continue to increase as the manufacturers had projected. In terms of vaccination timescales, we're following the national plan in terms of our local vaccination plan. We achieved milestone 1 at the end of February as expected. We are now working on milestone 2 and will achieve that by the middle of April. Milestone 2 is priority groups 5 to 9, and I'll go through that in the next slide. In addition to that, we're continuing our second dose vaccination programme for those who are in milestone 1. And we're also building up our No One Left Behind strategy, which I'll also touch on in a moment. So going into milestone 2, groups 5 to 9 are those that we are now actively targeting and that we will have fully offered first vaccinations to by the middle of April. In fact, group 5 has now been almost completed and group 6 is well underway. 7, 8 and 9, which picks up all of those individuals aged over 50, are the remaining groups that we are now starting to work in, and individuals will have received or will soon be receiving invitations accordingly. Group 6 is a complex group. It broadly covers individuals who have been shielding or who have health conditions that merit earlier vaccination, but who didn't fall in higher groups. And it also includes eligible unpaid carers, and I will touch upon that in a moment. In terms of No One Left Behind, I really want to get the message out there that if you think you should have been vaccinated by now, but you haven't been, please don't worry. You haven't missed the opportunity. We will always vaccinate somebody from a higher priority group if, for whatever reason, they weren't able to have their vaccination along with their peers. There are lots of reasons for why that might have occurred. Sometimes it's because people were unwell at the time. Sometimes it is because we were unaware of them, or sometimes because people have then moved into different groups as a consequence of age or illness. In those situations, all people need to do is contact us on the vaccination line and we will book them in. In terms of identifying those people that we're not aware of, we have a proactive search process in place that we are following with our partners to try to identify those people that we know we don't know about. Homelessness, for example, may be an example, and some people who are not registered currently with their GPs, in order for us to contact them. But I would stress that anybody who hasn't received any contact, who feels that they should have done, or anybody who is aware of somebody that they know should have received contact by now but hasn't, simply needs to contact us and we will then make the necessary arrangements. Unpaid carers are now included within the current cohort that are being vaccinated. There is very clear guidance from Welsh Government in how to identify those people that are eligible under this section. It partly depends upon the individual that is being cared for, having the necessary level of clinical vulnerability that puts them at risk. It requires the carer to be delivering care which meets certain criteria that puts the carer at risk, and it requires the carer to be the sole or primary carer. If people follow onto our public website and follow the section on coronavirus vaccines, they will find an online form which unpaid carers simply need to complete in order to be included within this cohort. It's a simple enough form, and then we will get in contact back with people to make the necessary arrangement for those who are eligible. I've put the link within the presentation there to the full guidance from Welsh Government for those people that would like to look at that. Finally then, reporting of key decisions made. Alongside this presentation in the pack today, there is a paper outlining those decisions that have been taken through EIMT, and I will take that paper as being read. I think the only thing I would just point out is that in all of those decisions, where any change is required, all are supported by a risk assessment. They are all clinically led in terms of how we reach the right conclusions, and all have IPC and safeguarding assessments where that is appropriate to ensure that we are not disadvantaging anybody or introducing any unexpected risk. On that point, Chair, I will finish the presentation and look to my colleagues to support for any questions.
Thanks very much, Chris. Can you take the presentation down for me?
I thought I had, bear with me.
Still got your desktop.
There we go, found it.
Thank you. Okay, so I've got a variety of questions. So I'll start with Medwyn.
Diolch yn fawr iawn, Cadeirydd. Thank you, Chair. As we all know, this is an extremely serious issue in Ysbyty Gwynedd. And it must be extremely disappointing and frustrating for all the staff, and we all appreciate that, Chris. along with being, of course, very disturbing for patients and relatives, especially when so much good work has been done during this difficult and exhausting 12 months we've just been through. Just before the outbreak was confirmed in February this year, ironically, we seem to be at the beginning of the end, with the light starting to appear at the end of this very long tunnel we've all been in, with the vaccine rollout, of course. And the question moving forward will be to address the how, given the outbreaks which have occurred on other sites and the lessons learnt there and the sharing of information gained elsewhere. Was this situation preventable or inevitable? Needs to be addressed, and no doubt in due course, following the external review, we will get more information and the answers. But the main issue is the here and now, of course, and where we find ourselves in Bangor. There are real concerns about local community transmission in Bangor, with a rate 3 times more than the rest of Gwynedd, with Gwynedd one of the highest in Wales, and it completely out of sync with other areas, and that this outbreak may be, and I stress may be, as a result of issues at Ysbyty Gwynedd. As you know, Bangor went into lockdown before the rest of Gwynedd, and the numbers are still extremely high. And the public now need confidence in our service moving forward at this site, as indeed we as a board do. Chris mentioned a decrease in the Ysbyty Gwynedd numbers following interventions, which is good. But do we have this outbreak now under control, or as close as we can get it, given the timeline, and that the site is safe? These are difficult questions, but as we possibly head to a third wave in the autumn, can another similar situation be avoided, especially with the more vulnerable in our society, and those who have not been vaccinated being more exposed, and new variants coming online as restrictions are lifted? These are difficult questions to answer, but these are questions asked of me, and our population need to know the answers. And I therefore welcome the external review, which no doubt will lead, I hope, and we all hope, to better outcomes. Thank you, Chair.
Thanks, Medwyn. So who proposes to respond to Medwyn's question?
So perhaps, Medwyn, if I open up and maybe just then ask Jill to pick up some bits, and maybe that Teresa wants to pick up some bits. If I can open up on the local community transmission, work has been undertaken in terms of trying to establish whether or not there are connections there, or whether or not there are reducing community levels, or whether or not that's been affected. My understanding from the data that I have seen most recently is that a clear connection has not been made, but I will commit today to go away with Public Health Wales colleagues and just establish the veracity with which that view has been reached.
I think the more substantive question from Medwyn was, and thanks, Chris, is the outbreak under control, and what assurance can you provide in that regard? Medwyn, am I right?
Yes, that was the main, the here and now, basically. Is the site safe, and can the public have confidence in the site?
And on that part, I think Jill may be able to answer more in depth.
So thank you, Medwyn. What I can tell you is the OCT meetings, so the outbreak control meetings, continue to take place on the YG site. What we have seen is a number of wards reopen over the last few days. So it's gone from 7 wards affected to 4. We're anticipating that 1 more may reopen today. Does that give us confidence that the outbreak is under control? It gives us confidence that the measures that we are taking, and Public Health Wales and our staff side colleagues support us within those meetings, are beginning to have an impact. We are testing the actions within the OCTs with those colleagues to see whether we can do more. and they are working alongside us and giving us confidence that the things that we are doing are the right things. I hesitate to say, and you will never hear me say, will there never be another outbreak? What we are endeavouring to do is to reduce the impact of this, and I think we can see the actions now beginning to have an impact. What I can also say, because one of the concerns for the local public was as Chris outlined within his slides and his report, the cancellation of some of the essential services. We are now working on plans that are going to come through EIMT this week to reopen to essential day surgery. That will be obviously under the auspices of IPC sign-off, but we're confident that that decision can be made given where we are currently with the outbreak. I can also report that I have visited the site last week with our CEO, Joe Whitehead, but I also visited with ARPAN yesterday. There is a significant and palpable difference in terms of the immediate visibility of the controls that are in place. And can I thank our volunteers and healthcare support workers who are at this point in time challenging people coming into site to say whether they need to be there, because I know some of the conversations they've had have been quite difficult, but I hope the public, and I know the public, will bear with us at this time. So I hope that begins to answer your question, Medwin, that the actions do appear to be having an impact. I know ARPAN walked the site with me yesterday. We had full medical engagement at the meeting he and I had, and they are looking at even some digital solutions to minimise the footfall on the wards to mitigate against the spreads, such things as was discussed with us around virtual ward rounds, for example, to support board rounds which would normally be in place. I don't know whether ARPAN, you want to add anything to your observations from yesterday.
If I may, Jill, thank you. Just to add on to what Jill has said, we had a really constructive conversation yesterday in YG, and one of the things I highlighted, which was really went down quite well, and we hope to see further impact of that, was the benefit of a visible medical leadership in things which are done on an operational basis every single day, such as highlighting to the clinical teams the importance of adhering to IPC measures, as well as there was quite a lot of very good conversation in terms of, as Jill has said, how can we do things differently in the COVID climate, such as virtual ward rounds. So I share Jill's optimism in terms of further impact as a consequence of the conversations we are continuing to have with the site.
Okay, thanks both. John, you next, please.
Thanks, Mark. Thanks for the presentation, Chris. I think the thing I was just wanting to pick up on was the human factors approach. I just wondered whether you could give us a little bit more detail on what human factors are being considered. Is it system and process design or equipment design and how that affects people's behaviours, or are you looking at a wider sense of human factors in terms of that sort of scientific discipline?
Interesting question. I'm quite happy to share some of it with you offline and also pick your brains. But my point really was broadly that we're looking in a broad way at all of the things that human beings maybe do, or how they interact with equipment, and circumvent good process for good reason a lot of the time, but understanding why that then gets us into a position where uncontrolled transmission occurs. We've identified a raft of different factors already. but perhaps if we could have a conversation offline, you'd be able to help with anything that we haven't already considered.
Okay.
John, I'm happy to be a part of that conversation. There is some behavioural factors work that we're doing, and we're engaging with colleagues from Health Improvement Wales as well to support us in some of that.
Okay, thank you. Thanks, Mark.
Thanks, John. Avion.
Ia, diolch yn fawr iawn, Mr Cadeirydd. Yn gyntaf, ga i jyst deud ar y adroddiad, Chris, diolch yn fawr iawn am y newyddion positif ar y rhaglen brechu. Mae hwn wedi bod yn mater llwyddiannus iawn i'r bwrdd. Dwi'n cofio nôl i mis Ionawr, mi oedden ni gyd yn pryderu bod sut o'n i'n mynd i gyflawni ar y targedau yma, ond da ni wedi gwneud job arbennig o dda, a llongyfarch y rheolwyr a staff ar y mater hynny. Mi a'i mlaen rwan i'r sefyllfa yn Ysbyty Gwynedd, a dwi'n hefyd yn rhannu lawer o pryderon o sylwadau ar ei medwy'n wneud yn gynharach. Dwi'n croesawu y ffaith bod ni'n mynd i gael adroddiad allanol ar y sefyllfa maes o law. A dwi yn gobeithio fawr yn bod ni'n mynd i gael yn adroddiad ne sylw sylweddol ar yr gwersi cath ei dysgu yn y sefyllfa tebyg iawn yn Ysbyty Wrecsam blwyddyn dwytha. A dwi'n gobeithio bod y gwersi yma wedi cael ei defnyddio ar draws y bwr iechyd yn cynnwys Ysbyty Gwynedd. A byddai edrych ymlaen i weld hynny yn y adroddiad. Y sefyllfa presennol wrth gwrs sydd yn poeni ni, a mae Medwyn wedi gofyn y cwestiwn am hynny. Mae'r sefyllfa wedi mynd ymlaen wan ys dipyn o wythnosau. A mi o'n i'n codi'r mater, dwi'n meddwl mis Ionawr, o'n i'n gweld y ffigurau yn codi'n sylweddol. Dwi'n meddwl, Chris, bod chi wedi edrych ar y chartiau cyn dolyg dwytha, oedd y sefyllfa lawer gwell yn Ynys Môn cyn dolyg dwytha na yn gweddill Cymru, ddeud y gwir. Yn yr isla, so mi oedd y sefyllfa yn poeni ni, hyd yn oed yn dod i mewn i mis Ionawr, sut oedd Ysbyty Gwynedd yn mynd i allu darparu gwasanaethau. So felly, dwi'n derbyn bod chi wedi gwneud sylwadau, a diolch Jill am wneud hynny ar y sefyllfa presennol. A gobeithio wir bod ni ar top pethau rwan, a bod ni yn mynd i weld y sefyllfa yn gwella reit fuan. Yr sefyllfa rhoi gwasanaeth llawn i bobl ardal yma Gwynedd yn Ynys Môn. Wrth gwrs, mae llawer wythnos rwan, da ni wedi bod yn gallu gwneud hynny, dwi'n derbyn pam, ond dwi'n falch o glywed bod adolygiad wythnos nesaf mynd i gael ei wneud ar hynny. A dwi'n gobeithio, Jill, bod ni'n gallu rhoi gwasanaethau llawn i bobl yr ardal yn Ysbyty Gwynedd wedyn, a bod nhw'n teimlo'n saff yn mynd i'r ysbyty. Hefyd, wrth gwrs, cyn dolyg, mi oedd Ysbyty Gwynedd yn helpu allan Wrecsam a dwi'n meddwl Glan Clwyd yn cymryd dipyn o'r gwasanaethau ganddyn nhw. Dwi'n gobeithio hefyd bod hynny'n gweithio ffordd arall hefyd ar hyn o bryd, a bod yr ysbytai arall, sgynnon ni ar draws y bwr iechyd yn rhoi cymorth i staff a cleifion yn Ysbyty Gwynedd. Mae adar ar hynny, diolch fawr.
If I may respond, Chair, to give you assurance, Ivan, that the mutual support that Bangor was kind enough to give to Wrexham during their outbreak, that is being considered and is happening as we speak. The other point I'd like to make is each of our sites, and I include our area sites, are being asked to do a self-assessment against the recommendations from all the outbreaks that we've had. That will be undertaken and is due back. I want to say, I'll confirm offline, but it is later this month. So we are asking for that self-assessment to be undertaken across all our areas. I'd also like to say that we have pulled together and reinvigorated the Safe Clean Care brand with representation from all of our divisions and getting not only good support, including from our communications and estates and facilities teams, but a lot of enthusiasm. I think every one of our staff across the whole of the health board, this isn't a position they wanted to find themselves in. Chris has alluded to the fact that perhaps the human factors of I've had my vaccine, I feel safe. Some of the measures that we've put into place that perhaps have been breached, that we are going back and assuring ourselves that is happening, and the lessons learned from the OCTs as they are taking place are going through that safe, clean care mechanism to ensure that they are learned in real time. I will confirm, Vivian, I'm expecting that decision around the essential services day case surgery to be undertaken either today or tomorrow. Certainly Arpan and I had a conversation about that yesterday as the clinical leads. So I will confirm offline that when that decision has been taken, or if it hasn't been taken, why not?
Do you want to comment on the external review?
Fiona, if I may just respond to your questions around or your observations on the external review. I would like to confirm that the external review has been commissioned, and the questions the review will consider do include not only the circumstances around the YG outbreak, but specifically to consider any lessons learned from the YM Ystad-y-Milo outbreak, as well as to consider the corporate responses, the policy pieces, the communication expectations that the board put in place at the time of the Ystad-y-Milo review to review the extent that those lessons were learnt in YG. We're also taking the opportunity to re-review YM and YGC in terms of making sure that we're continuing to be incredibly careful with regard to infection control across two other main acute sites, and of course across our whole estate. The external review has been commissioned with the express intention of publicly sharing the external review at a future board meeting. Thank you, Effion.
Just before I bring others in, so my expectation would be that the terms of reference for the review are shared. It's all very well suggesting the report will be provided to board. Given the level of concern that exists amongst independent members about the outbreak at Ysbyty Gwynedd, then I expect the terms of reference to be shared with board before the review is commissioned. So somewhat disappointing to hear it has been commissioned without the terms of reference being shared. So we'll need to pick that up outside.
So I will pick that up with you outside, Chair, and very happy to do so. Thank you.
Cheryl.
Thank you, Chair. Thanks. Chris, thank you very much for your presentation. I've got two questions for you. Talk about carers now, unpaid carers. They've been asked from Tuesday, as you say, to complete an online form. Now, most of the elderly carers that I speak to in my day-to-day work, they haven't got the necessary digital skills to do the online forms. Please, can you assure me that we are reaching those carers, because they are the most vulnerable in terms of often caring on their own for elderly relatives, and I'm extremely concerned about how we reach them and how we keep them safe and the cared for safe. And that's my first question. Thank you.
Okay.
I can answer that, Gerald. It was one of our concerns when we saw how the methodology. So we are linking with local authority colleagues to see how we can reach those people that really do need this support via dare I say it, the old-fashioned mechanisms of paper. So we have met with the project lead for the North Wales. Our teams met with them to see how we can address that, because that was our own area of concern. So that meeting has already taken place and obviously has been taken forward. If I may as well, while rather, and then I can take my hand down, it is worth saying that on cohort 5, we have already achieved 86% against cohort 5. So we are very much into cohort 6 of the vaccination programme.
Thank you very much for that, Jill. And I think if this pandemic has taught us anything, it's that we need to know exactly who our people are out there. I've campaigned for many years for GPs to hold a comprehensive register of our unpaid carers, and some practices are absolutely excellent and some aren't. I found a very hit and miss attitude across North Wales. So I hope that this will be something that we can really focus on once the initial serious work of the pandemic. Now something afterwards, we can make sure that all GPs make this a priority. This pandemic has shown us that. So thank you for that, for those reassurances. My second question, Chris, was, can I ask what's the position regarding coronavirus in HMP Berwyn? Thank you very much.
Yes. Thank you, Cheryl. Firstly, in terms of the carers and GPs going forwards, I wholeheartedly agree with that. Not much more to say, I don't imagine. In terms of HMP Berwyn, they have had some episodes where there have been some transmissions, which I imagine you would appreciate is not necessarily uncommon within a confined space where people have limitations in terms of their liberties. So they did and continue to have a clear plan on how to manage that site as clearly as possible. In terms of our support into HMP Berwyn, I think it's fair to say that the healthcare provision in HMPB is second to nowhere, and that extends in terms of our support for individuals with coronavirus type symptoms. At the moment, we have relatively few individuals receiving interventions for any suspected coronavirus type symptoms. I hope that continues to be the case.
Thank you very much, Chris. Yes, I know from the inspections we've done that the healthcare provision there is absolutely excellent, and I'm just hoping that our colleagues there continue to be supported, to the best of our ability during this. Thank you very much. Thank you, Chair.
Thanks, Cheryl. Lucy.
Thank you very much. If I could just go back to the outbreak for a moment. We've talked for a while now in QSE committee about the need for the health board to fully understand and embed organisational learning. And we've had various discussions about the need to close the loop as well. So I'm pleased to hear that, Joe, that you've confirmed that one of the things that's going to be looked at out there is why that hasn't happened. I think this needs to also come back to the process that we discussed at the last QSE committee about having effectively a closed down report so that we can have assurance that these lessons that are being learned are actually going to be then implemented. Thank you.
Anyway, we want to respond to that. Chris, Jill, who's coming back?
I'm happy to respond. I recognise the conversation that Lucy is referring to at QSE, and I think the committee wholeheartedly supported the fact that it wasn't about just putting initiatives in place, but we needed a mechanism to ensure that they were embedded. and the committee, both Lucy and I, took that away as perhaps something to reflect in future terms of reference and in our committee calendar. I think that's fair, Lucy.
Yes, indeed. Thanks, Jill.
Right, I can't see any other hands up, so I've got a couple of observations. I think the last point is really important. I seem to recall that a recommendation from the YM outbreak and review was to embed the lessons that have been learned. My question will be, and no doubt we'll see an exploration of it in the independent review, is were they embedded? It would seem not. If they were not embedded, why not? And the extent to which breach behaviour, as Jill referred to, has been a factor on the site and what we've learned from that. I struggle to understand how it would seem that YG as a site have walked into this, given the experience that we would have hoped we would have gained from the outbreaks at the other sites. And that is, of course, a concern too. In terms of community transmission, Chris, I think you undertook to look at that. We've now been contacted by the leader and the chief executive of Anglesey because they themselves are concerned about trends within their community. I understand that Fion from our site and Alison are meeting with officials or officers from that local authority later this evening, but Joe and I have now got a call with the leader and the chief executive. So it'd be helpful to understand what our take is on what's occurring in terms of community transmission and any sense that relates to the YG outbreak, please.
Okay, I'll pick that conversation up with Public Health Wales today.
I think it would be also useful to the board to see a discrete data set about the outbreak at YG. You've said the situation is improving. I'd like to see that data, please, just for further assurance. A couple of other things from me.
Mark, sorry, Chair, I'll ensure that's shared with you later today.
Okay. And then I want to come back to, at some point, the outbreak plan that was shared last night with with board members, but we'll do that outside of this meeting because I'm conscious of the time. Couple of other things. So long COVID, Chris, Adrian, is something that is now featuring quite significantly in terms of concerns being raised with us and being raised nationally. Can I just check where we are in terms of our response to long COVID, please?
Yeah, certainly. There's a proposal coming to exec team, to the next exec team, in terms of the support required to coordinate a long COVID response. It's fair to say that we've seen less referrals for long COVID than had perhaps first been anticipated when the concept was first discussed. But nonetheless, the response to it is an MDT response, and we need to be probably geared up to that. In the meantime, there's been a wealth of guidelines come out from respective clinical groupings, which we are in receipt of and working through. So I would anticipate that the exec team will support the coordination that's required, and will then be in a position to report back to board a long COVID service.
Thanks, Chris. Then in terms of vaccination, Jill.
Mark, did you want me to add to that? Happy to add to that.
Go on then. Yeah, okay.
So as Chris said, we've established a group. We've got really good engagement with that group from clinicians across the health board. As Chris has highlighted, just being really careful, or not being careful that around the numbers, and we're doing some work around the numbers, around exactly what we established. There is guidance from Welsh Government with the pathway, and we're looking at that and looking at how we localise that, also working with other health boards, and now Bevan and Swansea Bay have pathways too, and we're looking at those to localise those in order for our own use, trying to maintain as much of this care as close to home and in the community as we possibly can. So we've got a really engaged group of clinicians and making progress. Welcome the bid coming to exec team.
Thanks, Adrian. And then finally, in terms of vaccination, so you circulated a plan last night, Jill, but there are some further information, or there is some further information to go into that plan. Can I just confirm then we expect to see that by close today, particularly in terms of the jump-off points or the offer points for the remaining.
Sorry, Chair. Sorry for coming in a bit early there, but yes, the information I've asked to go into the plan is the anticipated times when we can expect cohorts to be called, so that people can anticipate when they are going to be called. So that is being worked on this morning. I've been advised that we will have it this afternoon. With that in place, I will circulate the plan. It is being translated to be uplifted onto our website. And can I publicly thank our local authority and other partners who have helped to contribute to that plan, and their comments are being fed into that as we speak.
Thank you. So I just want to end by saying there's been quite a lot of dialogue in that exchange and presentation around the outbreak. I want to clearly communicate that as a board, any death or harm that arises within our own heights is a travesty in its own right, and clearly it's incumbent upon us and you as the executive team and your colleagues across the sites to minimise the harmful impact possible of acquired infections, and to do all that we can to minimise the risk, encourage people to use our sites when they need them, which I think is at risk at the moment, as Medwyn and Avion have commented upon, and also to limit the impact of in our communities from transmission moving out of the hospital. So I think it was absolutely right we spent the time we did on that topic, and we look forward to receiving further updates as we move forward. Okay, so I'll close the COVID item there, and we'll move on to the targeted intervention and maturity matrices. Jill.
Thank you, Chair. I will take it that the paper has been read, but I just want to bring the board's attention to the actions that have taken place as a consequence. So, as the SRO for this piece of work, we have had a meeting of the leads for each of those streams, and we have discussed the terms of reference, and we have agreed with some minor alterations that they should be supported. The other issue I'd like to bring to the board's attention is that we are looking at mental health in its totality. So that includes both CAMHS and mental health. I'm happy we have a timeline within the document that is articulated within the document, and I'd like the board to note those timelines. And we are progressing on the maturity matrices and have a further meeting ahead of the board workshop. Louise may want to add some detail.
Okay, I think we're discovering why they say never work with animals, Jill.
I'm so sorry, they've been quiet all the time until then. So
they have. They've been patient. Louise, is there anything you want to add?
No, nothing from my point of view, other than obviously we've now discussed the link IAMs, the support IAMs to each of the matrices, which I think is really helpful, and I think we're looking forward to continuing that work together as a group. I know Simon's on the call as well, so he may want to comment.
Okay, before I open it up, Simon, anything from you then? I take it not, Joe?
Thank you, Mark. Just to confirm that I spoke with the Welsh Government official who is leading the TI, targeted intervention process with us last night, and can confirm that we have our first meeting with Welsh Government regarding targeted intervention now approved, and we're just going through the process of making sure that we have we're doing all of our pre-meeting preparation using the maturity matrices that Jill has drawn your attention to. Thank you.
Thanks, Joe. So,
sorry, Mark, that was all I was going to add as well.
Okay, all right, thank you. So we are asked to note the framework, the progress to date in developing maturity matrices for each of the domains, the progress in development of the governance and assurance processes, and the timeline. Are you happy to do so?
Yes.
Yes.
Yeah. Lynn, I see your hand's now gone up. Is there something you want to raise?
Sorry, I did raise it earlier. Do our staff understand what targeted intervention means, and is there a communications plan to ensure their involvement?
So I'll start on that, if I may, Lynn. So one of the conversations we had at the first meeting, Lynn, was to consider how we could get the messages out to a number of, to as many of our staff as possible. And as part of that process, each of the executives are working with their teams around the cascade, which meetings they have available to them on a cascade mechanism. I know that Simon has presented to a number of meetings alongside that, and we are collating that information. Any questions or points that comes back from that will become part of our evidence, if you will, on our maturity matrix moving forward. Simon, I don't know whether you want to add, because I know you have met with some of those groups.
Yes, certainly. Thank you, Jill. And what we've done is developed and agreed a single slide deck that is quite detailed, but people can pick and choose the slides so that it's not just reliant on me and the SROs to have that conversation with people. We can use that within team meetings. So we're taking that slide deck around, as Jill says, various team meetings, as well as with some external stakeholders, so that we can share the message across. And so far I've presented it 2 or 3 times and it's gone down very well.
Thank you.
Joe, you want to make a comment?
I do, Chair, but it is with regard to the terms of reference associated with the external review. So I'm very happy to take your guidance on that. It is just a very quick update and assurance piece for you, if you're happy to take that point at any point during today's meeting. Thank you.
Let's deal with that now then. So are we talking about the terms of reference to the review of the outbreak?
Yes. So I've been able to do some quick delving and checking, and I'm pleased to be able to say that the terms of reference are still in draft. And so there is an opportunity for board to make comment on those terms of reference. Apologies, entirely my mistake. I had forgotten that the external review hasn't actually commenced yet, so we still do have that opportunity to share those terms of reference. I'm very happy to set the record straight on that. Thank you.
Thanks, Joe. So we look forward to seeing them then. Thank you. So I'm going to come back to the targeted intervention framework. I've already said the things that we've been asked to note. A number of people start to confirm that they were happy to do so. So unless the centres, I'll take it as we've agreed to note the things that are listed. And I'll move us on now, Mark, to the performance report.
Thank you very much, Mark. So this is the first of 2 performance reports that we've got before us as a board today. And the first point I want to make is that they are in many senses companion pieces. We do need to look at both of them together. The first report reports on our progress against the board approved plan for Q3 and Q4, and where we assess our performance as being at the end of January. The outputs and outcomes from all that hard work are reflected in the quality performance report that we'll come to in the next item on this agenda. I think the report describes a significant level of achievement against a number of the headings that we set out in the plan, but in this very brief commentary I'm going to focus on those areas that are assessed as being either red or amber. One of those relates to stroke services, and when we look at our performance, we will see that our performance on stroke services is not where we would wish it to be. So in terms of our plans to improve stroke services across North Wales, I can advise the board that we had a business case, the executive team yesterday, that subject to 1 or 2 more pieces of work were cleared to go to Finance and Performance Committee before the end of March. So really pleased to see that piece of work, which has had a significant kind of gestational period, if you will, is now progressing to some kind of conclusion. I also wanted to mention the Diagnostic and Treatment Centre, which is referenced in the context of planned care, and specifically around orthopaedics. Again, the executive team has been working now on a strategic outline case for 1 or more diagnostic and treatment centres across North Wales. And again, that report is on track to come to the Finance and Performance Committee at the end of the month. One of the questions that IM colleagues have submitted in advance relates to the inclusion of orthopaedics within that diagnostic and treatment centre work. So I just wanted to say a little bit about the background to that decision. So firstly, to be clear, that orthopaedic inpatient services are included in some, but not all of the options within the diagnostic and treatment centre strategic outline case. The reason why we took that decision was to respond to our clinicians who have been increasingly keen that we should take the opportunity presented by the Diagnostic and Treatment Centre programme to explore the potential to develop more of an elective orthopaedic treatment centre approach, delivery of orthopaedic planned care services across North Wales. So we're responding to the views of our clinicians, and that's why we've taken the view to include orthopaedics within the DTC work. Clearly there is a risk if the DTC doesn't progress in the way that we expect it to and that we are committed to achieving. So that does represent a risk, but that is something that we need to kind of face head on if that's a position that we get into. So I think those are the 2 points I wanted to highlight from the report, Chair. I'm conscious that a number of questions have been submitted in advance by IM colleagues. I'm not sure how you want to place it. I presume that we want questions to be asked, and then I'll bring in the relevant execs to answer if that's okay. Thank you very much.
Thanks, Mark. So I've got Frank on, who wants to come in first. Frank on.
Thank you, and thanks, Mark, for that. My question was around stroke, and you've partly answered it with the sort of business case, because stakeholder reference group received a presentation some time on the review of stroke services. So I'm pleased that has finally, or appears to be in the final furlong of some decisive decisions around. But my question, I'm raising it now, but it's actually on the next set of reports. It is around the stroke performance, which is showing 23% of patients, being admitted to a stroke unit when the target is 95%. And I'm a bit unclear from the narrative of that report as to what the reasons for it. There's an emphasis in the narrative around a lack of stroke coordinators and specific gaps at weekends and I think evenings. So I just wondered whether you could provide us with some assurance regarding the here and now, because of the poor health outcomes that this particular performance will lead to. Thank you.
Thanks, Francon. I'm going to invite Jill to comment on that, if that's okay.
It is.
I will commence. Mark, I don't know whether Arpan may wish to come in on this, because I know he's been instrumental around the business case. So these areas are of concern to us, and I know there are also concerns about access to CT in the most timely manner, and the impact that COVID has had on turnaround times to support that. I think the accessing of the stroke beds has been an area we concentrated to ensure that wherever possible, people are getting that access, and I think it is beginning to improve. It is an area that I know Arpan has picked up as part of his business case. So if I may, I think Arpan, you may be closer to this than I am.
You're on mute.
You're on mute.
Apologies. Yeah, just to reflect on the numbers, I think, you know, we all have acknowledged as a health board for some time that our stroke performance needs improvement. And one of the things that we have noted, and personally having taken over the business case process recently, is that we needed to really take a very close look at the clinical model that is in place at the moment. So the board members will be pleased to hear that yesterday at execs, we actually had a presentation on this very subject, and we looked at the refreshed clinical model, which has received quite a lot of support, and we hope to take the business case further forwards. There are some elements which still need some additional data, and before long presented to the F&P committee for onward progression. And within that business case, we've articulated very, very clearly as to what the clinical returns are going to be on the investment that we are seeking permission to make.
Thanks, Arpan. Frank?
Can I just respond? I'm comforted by, you know, the emphasis on the business case, but I'm not getting an assurance about the here and now relating to the narrative in the report, which puts an emphasis on the lack of stroke coordinators. And it says access to stroke, and this is on page 16 of the following report, in the headed quadruple aim 2 narrative stroke care. And the first sentence says, access to stroke coordinators due to staff shortages. Stroke coordinators in the East have been included in the ward numbers recently and are unavailable to respond to the bleed. And it goes on, and it also mentions that CT is not an issue. Access to CT or capacity around CT is not an issue. So what I'm after really is, it would appear that their staffing is an issue, and you know, we all know that that happens you know, every so often, but given the performance, I just want an assurance regarding the priority here and now, really, accepting all the good stuff that will come through the business case that will provide longer term assurance. So I don't know if you can come back or you know, take it outside the meeting if you prefer.
So, Fancon, I think it would be really helpful if Arpan and I could update you offline in terms of redeployment of staff, and that has been an issue, as we know, for a number of subspecialties. There is work now ongoing to forgive the terminology, to pull those staff back into their areas where they would normally be working. So that piece of work is commencing. I think what Arpan and I can do offline is probably give a bit of a timeline of what the anticipation of that might be.
That would be really useful, and thanks.
And when you've done that, Jill, can you share it with the wide board, please? So we're all cited.
Happy to do so, Chair. If I share it with Klenos, she can circulate to everyone.
She can. Thanks. Thank you. Thanks, Francon. Lynn.
Thank you, Chair. Mark, thank you very much. You covered my points to do with orthopaedics. My other two questions are, when this report was written, it would have been at the end of Q2, prior, the beginning of Q3, which was before the last surge of COVID cases and before the lockdown. So much has changed since this was written in such a relatively short period. At what point do we say we can't meet these targets, these plans that we had, and when would we be clear and concise to say we will never meet these targets in these quarters? The reason I say that is I know that if you go through line by line and cross-reference, you can find where that will happen, but there's no one piece of paper to say, because of the situation we're in, we've now needed to drop these priorities and these plans. I would like it to be a little bit clearer so we can match it up to what really does matter to us as a health board.
Well, we're certainly clear, Lynn, that we need to address that as part of our plan approval for 21-22. So we're going to undertake a systematic review of all the things that are not showing as purple in this process. And we are reviewing those for inclusion in the 21-22 plan. But I'm not sure if that's exactly where you're coming from.
I think I would like it to be a little bit more live. So as it becomes clear that certain actions are not going to be met, we're absolutely clear at that point, as opposed to wait to Q1 in the next year.
Right, okay.
I think it just gives us all clarity, and it emphasises to us all what really, really is important to reduce harm.
Yeah, okay, thank you.
Thank you. My next point is on page 5. There's reference to developing and implementing plans to support patients to actively manage their symptoms. And yes, on page 10, which gives the narrative because it's red, it refers to the digital applications not being delayed due to IT capacity. But there's no indication as to what is happening, what's going on behind the scenes, because I would have thought this was a vital part to enable our patients to manage their own symptoms.
It is a vital part. I mean, I think other colleagues may wish to comment, but I can offer a bit of a perspective on this. Potentially, Chris, from a digital point of view, or Jill from a planned care perspective. But I think this is one of those examples that actually may fit your earlier criteria, Lynn, about things that we're struggling with because of things that have changed since the plan was written and signed off, although it was only last October. I think one of those areas and one of those functions that's come under significant pressure been informatics, responding to a whole set of demands that I think were known about at the time of the Q3, Q4 plan, but perhaps in scale terms, perhaps were not fully appreciated. And I think the most obvious example for those, at least for me, and I'll bring Chris in shortly, would be the impact of the mass vaccination and supporting that from a digital and an IT perspective. And I think that has knocked some things down the list. I think the assurance we would offer, and it is in this report, is that we need to pick up with timescales and with more clarity as part of our overall approach to planned care in 21-22. But I don't know if Chris would wish to add anything else to that.
Only just that it is exactly as you've just said, Mark.
Thank you.
Thank you. Cheryl.
Thanks very much, Mark. Just a quick question, Mark, around the CAMS issue. Just for clarity, really. On page 17, you say you've got a new supplier for CAMS and they began in January 21. But on page 16, you say restart face-to-face planned care assessments and intervention work once approved to start. I'm just checking what we have started, yeah?
Okay, so my apologies for the apparent inconsistency. I'm going to ask Chris to comment, but my understanding is that the process of backlog clearance has commenced. But I don't know, Chris, whether you've got any more detail to add on that point. If not, I'm happy to get back to you on that, Cheryl.
It has recommenced. And are we talking specifically about CAMS, Cheryl, or are you picking up the neurodevelopment too?
Well, all of it, but the CAMS bit there on page.
That has restarted, and from the neurodevelopment perspective, we have now secured additional capacity, some of which is from an existing provider and is kicking in as we speak, and some of which is due to come in over the coming months.
Thank you, Chris. An update on that would be really helpful to the board to know precisely where we are, and if we could have up-to-date figures, that would be great. Thank you.
Thanks, Cheryl. Lucy?
Thank you, Chair. So I have raised this before, but I don't find that this report actually provides very much assurance on the effective delivery of the plan. And the reason for that is because the actions documented in this report, they're not measurable. There aren't any outcomes to assess effective implementation. and the narrative isn't clear enough either to be able to answer what the action was supposed to be. Now, we provided previous feedback on this, but it doesn't seem to have been addressed, and this is one of the reasons why this report has not been scrutinised by QSE committee for the last couple of meetings, because we weren't getting assurance from it. I mean, some of my questions I'll now come on to probably reflect that point as well, because I'm not clear what's being done and what was originally the requirement. So, for example, Action 2.6 refers to a review of external capacity for key providers, and it's gone from a red to complete. According to the narrative, on the basis that the Health Board are ringing external providers. That doesn't seem particularly robust to me from the perspective of a review of their capacity. How is this being triangulated?
So if I pick up the report format question, because you're absolutely right, Lucy, you've expressed concerns about this report format for some time now. I think as you know, before Christmas, we shared some proposals for how this report and the next report could be presented differently. Shared those with both yourself and Mark, and I'm now going to be working with Louise and also with Joe to find some time at a board workshop for us to bring those things forward, so that we can have a collective discussion about how we can improve the quality of our performance reporting. Because I recognise it's a lively topic for the board at the moment, and I'm keen to respond to it. So that's the work that we're doing in terms of the report format going forward. I think the phrase "ring round" could have been slightly more articulately expressed on Action 2.2.6. But I'm going to ask Sue H if she would like to comment, because I'm aware that this is something that the contracting team lead on in terms of contacting other, I think, particularly English providers. So Sue H, I don't know if you'd wish to come in and add anything else.
Thanks, Mark. Yeah, I think, Lucy, from your perspective, we have a clear understanding of what capacity is available, and we have been able to sort of make contractual arrangements around that. I guess from a health board perspective, the challenge is about being able to utilise that in the context of the COVID activity. So obviously, whilst we understand what capacity was potentially available, our ability to use that has been affected by COVID response, both within the health board's geography and outside, if we're thinking about NHS England providers. I think if you need any more information, I'm happy to provide that outside the meeting.
Okay, thanks, Sue. I think the problem is none of that is really reflected in the report. It's just not clear why the review was required in the first place, what was being looked at, and then what actually has been done as a result. But if I could then just move on to my next question, because I'm conscious of the time. So 4.3, relating to the clinical strategy, refers to a fresh approach being discussed at board, and I know this was mentioned briefly earlier as well. Do we have timescales on when that's going to be?
So we did. So I think there are two components to this, as we described earlier on. Joe, do you wish to comment, because we did touch on this a little bit earlier on in the meeting?
Yes, thank you, Lucy. We are at the moment undertaking an engagement stocktake to look at all of our existing engagement opportunities, to work with our local authority colleagues and other partners around their engagement opportunities. Tomorrow, we're seeking advice from 3 other health boards regarding their best practice regarding engagement. And I'm expecting to hear after those conversations tomorrow some advice on what an appropriate timeline would be for us to begin both the Living Healthier, Staying Well refresh and the clinical services plan from a co-design engagement and consultation point of view. So we're incredibly close to having gathered best practice advice to be able to provide a good steer in terms of the likely timeline. Very mindful of the fact that we want to do full justice to proper co-design and engagement, but discussion around clinical services plan and our refresh can neither take forever. So it will be about that sweet spot, Lucy. Once we've got that advice, give me a little bit of time just to cogitate on it, and then very happy to share that with board colleagues as part of our wider engagement refresh. Thank you.
I think Sue wants to come in as well. Thanks, Joe. Sue, is it on this point?
No, it's on the wider point around this report, Mark. So I'll hold my comment if that's okay.
Okay. All right. Lucy, do you want to finish, and I'll come back to Sue then.
Thanks, because actually Sue may want to come in on my next question. So 20.70, which is on page 27. This refers to the review's been under. So this refers to the raising concerns review and the improving the mechanism. Now the target date for that was the end of January. It's reported as a green though, rather than a complete. So if it's not complete, shouldn't it be a red? But my question also is, where are we up to in relation to implementation on the basis of that timescale? Thank you.
Okay, so the colour coding for the RAD rating is green, on track with no risks. And I took a judgment based on the fact that we have undertaken the review, we have completed the review by the timescale, we have submitted the outcome of that review and a proposal for a revised Speak Out Safely process and cultural development, and we had done that by the date, albeit as you know, Remuneration Committee was on the 1st of February, so just past the date, but I took the view that I didn't want to turn it purple until we had actually implemented the revised approach. As we discussed at executive team in January and again at Remuneration Committee on the 1st of February, we have needed to put in an implementation plan plus a contract with an organisation that's going to be providing some support for us. We have an implementation plan in place. We are moving forward with the contract for the platform that is going to help us with the new process, and we are on track for a soft launch as discussed at a Remuneration Committee by April. So this report, which is based on January, my view, my judgment at that time was that it should remain green. It isn't red because we had completed the review, which was the measurable, which doesn't actually appear in this report, but was the measurable against the plan. But I didn't want to turn it purple until we've actually put the revised process in place. So again, in the next cycle, when the relevant committees see this report, it currently is still green, unless clearly you want to advise, or the board wants to advise that otherwise.
Okay, thank you.
Okay, sorry, so you're coming back.
Yeah, so my point, I suppose, on the wider report, and we know that we've had a number of discussions around this as a board, and indeed have had a number of discussions at the relevant committees, so both at Quality and Safety, Finance and Performance, and SPPH over this cycle, about the interrelationship between this report, which is a monitoring report, the assurance, i.e. evidence of output or outcome from the actions taken, comes from a range of other reports. But also this report needs to be seen in the context of the board assurance framework, as well as the wider environmental context. So I think the conversation that Mark alluded to that we need to have with the board is really, how do we place this report within that wider context? There are some suggestions, which again, Mark alluded to some proposals late in 2020. But I think, again, some of the conversations that we've had over the board cycle with the respective committees I think have started to prompt a kind of another set of thinking, not separate from the proposals at the end of 2020, but I think to further enhance them. So, for example, rather than a kind of an isolated narrative, it might be helpful for us to put something in around how does this relate to other reports and kind of direct board members to other reports that actually provide the more detailed position statement, the more detailed level of assurance, and indeed the impact that other risks may have had. I would agree with something that Lynn said, I think a little bit earlier, as well as your comments, Lucy. I think we need to get into a place where we can review the plan, the aspects of the plan, see whether actions have been superseded by other external or internal factors, whether actually we need to reprioritise given increased risks that have been identified either through the corporate risk register or the board assurance framework. But I do think that would be a really helpful conversation to have as a board. We know that the power of bringing the collective of the board together around the board assurance framework development and this plan as it stood coming into this year, which again is a significant improvement on the previous year. I genuinely think that there is a really strong conversation for us to have, which will further improve this report from the improvements that I think everybody acknowledged at the beginning of last year on previous year's reporting. So it's kind of a learning cycle, recognising that there are still some frustrations, there are still some issues in terms of the quality within them, but I still think that this is a better report than we received this time last year, and definitely a better report than the year before. So I suppose it's just recognising that learning cycle and the need for us to engage in this as a collective.
Thanks, Sue. So we have a workshop session due in April. I think it needs to be our ambition that we agree the reporting and assurance arrangements, including the new performance report, Mark, as close to the start of the new financial year as possible.
Yeah.
So I think that has got to be our joint ambition in this regard. A couple of things I wanted to say. So I think it's important to recognise that this is not the only place in our government structure where due diligence is exercised over this report and delivery. It is occurring at our committee meetings. Certainly a Finance Performance Committee, we sought assurance around a number of the updates provided in this report, and we either got them in the meeting or it followed. The particular speciality I wanted to raise, Mark, or specialty, was ophthalmology, because we had a conversation, did we not, around there is a read across, just like stroke, in terms of ophthalmology, in terms of the planned report and the performance report.
Yeah.
And I see that the business case around ophthalmology is due with exec team, I think, in March, according to the report. You just give an update around ophthalmology, because that is an area of concern.
Yeah, thanks, Mark. And the point about the read across is well made. It's exactly the same as stroke. So Jill, myself and Sue Hill had a discussion a few weeks ago. We reviewed the iCare business case that's been led by Alison Constantine, YG Acute Care Director. We'd got some, while strongly supportive of it, we'd got some areas where we thought more work was required, and that is still in train. I know a lot of that work is taking place, and I'm confident that we will have a proposal to take to the executive team shortly. It is also included within our plans for 21-22 as a potential use of the £30 million for performance. But you'll appreciate we need to be confident in the business case and in the robust nature of it. And last time we reviewed it as an executive team, we weren't quite in that place. I don't know if Jill would wish to add anything else, but that's my sense of where it's up to. Thank you.
Thanks, Mark.
I think, if I may, Mark, I think other Mark has articulated it very well, but the other thing I want to put on the table, there are conversations with Welsh Government who acknowledge across the whole of Wales that we need a different approach to ophthalmology. So those conversations are beginning in terms of a medium to longer term strategy for ophthalmics as well. So I think part of that business case is we need to ensure that there's a read across between the Welsh plans and our own, so that there aren't any missed opportunities.
Thanks, Jill. So Mark, let's move on to the performance report. And before we do, I think we need to take the report as read and also recognise too, this has certainly been subject of some examination in some detail at Finance Performance Committee. I don't want to cut it too short. I want people to be able to ask questions, but I think we've got a backdrop there that will help with the discussion.
Yeah, that's fine. I'm perhaps happy to open it to questions, Mark. I was going to highlight some areas of good performance, but mindful of the time, and clearly we can all read the report. We've had some questions from board colleagues. Perhaps we move into those straight away.
Thank you. And a number of hands have immediately gone up. So I'm going to go to Lynn first.
Thank you, Chair. I understand, and I'm now going to contradict what I said before about us changing priorities, moving track, and understanding where we are right now. And these tables tell us where we are right now. What it doesn't give us is any trajectories of the future. Now, I know that that is a very, very difficult thing, but at least could we have a band of a trajectory to say, if everything goes to plan of what we're saying we will do, this is how we will move forward. But within that band, there'll be a worst case scenario. And it's just to do with looking to the future and to tie in all the actions that we say we will be doing, or what the impact will be, but subject to changes of priorities and surges, etc.
So my sense of that is that that's exactly what reports like this should do. I think saying where we are is helpful, but clearly only up to a point. And I'd like us to move towards a place where we're doing just that. We say where we are now, but we also have confidence about where we're going to get to. I think in the past, we've perhaps got closer to that in some metrics, but I'm not sure that we've ever fully nailed it. Clearly, we are in this most strange time at the moment in terms of responding to the pandemic, and Welsh Government, for their purposes, has stood down any robust performance management of us as a health board across the whole of 2021, and aren't planning to step that back up into 21-22 yet, as far as we're aware. So strange times. But in terms of a performance report, should we be looking about where we are headed? Absolutely, we should. In respect of the plan for 21-22, we're starting to do some work because we have exactly the same questions there. If we make these investments and subject to some assumptions, where do we think we're going to get to in terms of some key performance indicators? And that's one of the things that I think the board has rightly asked for in respect to the plan that it will receive at the end of March. And that's one of the things that we are currently working on. We've selected about a dozen key of the most key performance indicators. And I'm working with colleagues to agree the level of performance that we think we should be able to achieve, subject to all those caveats. That's particularly crucial, Lynn, because it then paves the way for accountability, both between both at board level and also across the organisation.
But the plan does have to be agile enough to be able to recognise the best and the worst case scenario.
It does, and we need to set out our underlying assumptions behind the plan, so we're all clear about those. And we also, to Stu Green's earlier point, we also need to be clear, and to yours a little bit as well, we also need to be clear about when it's appropriate to vary the plan and be clear about the mechanism that we will do that. This has been such a strange year with quarterly plans and 6-monthly plans. Those things don't feel like they've been a tremendous priority for us in the middle of the pandemic, but I think in the context of moving back towards having a full annual plan, then those are absolutely issues upon which we need to be very clear.
Thank you.
Okay, I'm going to come to Avion next because I know his question relates to plan care. Avion.
Ia, diolch yn fawr, Mr Cadeirydd. Y sgwrs yn anffodus iawn. Dyn ni'n gweld ar draws y gwasanaethau rhestr aros yn cynyddu yn sylweddol. Dyn ni'n gwybod y rhesymau pam, mae'n hollol amlwg i wneud efo Covid. Ond beth sy'n ni'n licio gwybod, a dwi'n meddwl sy'n diddordeb i bwrdd a hefyd y Cyhoedd Gogledd Cymru, sut mae'r cynnydd yma yn cymaru hefo y cynnydd sydd yn gwasanaethau eraill byrdde iechyd a draws Cymru?
Okay. Thank you very much for your question, Avion. It's a very relevant issue. So prior to the pandemic, the report that we're looking at here, the quality and performance report, always used to contain a comparable league table. It showed whether it's from 1 to 6 or 1 to 7 where we stood on any given KPI against that. So it gave us that immediate comparable position that I think you're rightly looking for. Since the pandemic has started, that reporting has been stood down. So we have much less of that than we've historically had. But we have made some inquiries with Welsh Government on planned care, which I think was the area of your specific question. And we do not believe that we are an outlier based on feedback that we've had from Welsh Government. So we think we are in the pack in terms of the deterioration that we've seen during the course of the pandemic. Unfortunately, however, we had a poorer starting position compared to other health boards at the start of the pandemic. So that will be manifest in our total numbers. But we don't believe we have been an outlier over the last 12 months. What that points to for us as an organisation is keeping our risk stratification up to date and agile as patients' needs and circumstances change. So whatever capacity we've got, and we know it's still significantly reduced as a result of the pandemic, we're targeting that limited capacity on those who are in the greatest need, and that's obviously a clinical judgment that our clinicians make.
Okay, thank you, Mark.
Thanks, Avion. So, John, next.
Thanks, Mark. For some reason, I couldn't get it unmuted. Just a couple of things. One, reflecting on Lynn's question earlier, I think in terms of a process, in terms of how we improve reporting, we do need to make the distinction between what is the measure of our performance of our business as usual and the delivery of actions and a plan for improvement. And we need to be able to capture that somehow. Yeah. But the more specific question I had was around infection prevention and control. I suspect it was one of the positive things that you were going to highlight, Mark. But I just wanted to ask, it's one of the sentences in the exec summary. Yeah. Does it still hold true that we are still one of the best performing Wales in the light of the COVID outbreaks in our DGHs?
Yes, my understanding is that it does, but I think Jill will be much closer to this aspect than I am. But I think our performance still compares well. Jill?
It does, John, but one of the questions I've asked around the outbreaks, because there are outbreaks across other parts of Wales, is how we compare with those given our latest outbreak. I haven't got that information yet, John. I am seeking it.
Okay, thank you.
Medwin.
Thanks, Mark. Excuse me. I have mentioned it before, but I do think the images within the report should reflect the world we live in at this moment in time in terms of social distancing and PPE, because some of the images there aren't appropriate for the time we're living in at the moment. On page 45, there's a graph there, and I appreciate you trying to cram as much information as possible, but you're talking about jumps of 20,000 on the left of the graph in terms of COVID-19 impact on waiting lists and diagnostic waits. Perhaps we could present that in a different way or in a manner that we can actually read. But I'm intrigued, and you may have alluded as to earlier, I can understand why 36 weeks has gone into 52, I understand that. What I don't get is why it's plateaued from the beginning of the year to now, the top line, and what happened in December when it dipped. What was the explanation for that?
So I'll invite Jill to comment, but December dip, we historically across the whole of the NHS see a reduction in planned care work over the Christmas period.
No, I appreciate that, but these are waiting lists, aren't they? The waiting list would be constant, wouldn't
it? Which bit are you looking at?
Page 45.
Page 45 of the report. Yeah. So I'm looking at waiting list risk stratification.
No, am I on the wrong page? It's COVID-19 impact on waiting list and diagnostic waits.
I'm not sure. Can I pick that up outside with you?
Okay, yeah, fine.
Page before.
Sorry.
I think it's the page before.
I'll just see if I can get it. If there's an easy answer to it, then I will give it. If not, I won't. So COVID-19 impact on waiting lists and diagnostic waits. So we've got the kind of the waiting profile within those overall numbers. But your point is, Medwyn, that we've seen a plateauing in the total numbers waiting.
Yeah.
But within that, we are continuing to see increases in the number of long waiters.
Yeah. My point is, what's driving that? I would imagine it would continue to rise, would it not?
Okay, right, yeah.
Is it a question of people not being referred? That's the point I'm making.
Okay, so I think what's driving that, it relates to risk stratification, and we've moved away from treating people chronologically towards treating people on a risk basis. So that's my understanding of what is behind that. But I'm happy to look at that in a bit more detail, Medwyn, because that may not be a totally comprehensive answer.
So I think the point you're making, Medwyn, I will take it outside and pick it up. But in terms of the referrals, we haven't seen the same level of referrals, and there has been work with our clinicians, as you know, to look at other methodologies to manage patients as a consequence of that. What I cannot explain in terms of your question, I'm happy to take away with Mark, is the dip in December.
Yeah, and what we're not getting from this, whether this is a good news story or a bad news story. That's the point I'm making. Is this a crash coming our way when we come out of the pandemic, or is this controls in place plateauing the numbers out? That's the point I'm making.
I think it's fair to say that we're absolutely clear that the planned care challenge that we have now and coming out of COVID is quite significant. I would also add to that as we do see more people referred in, that those numbers may well increase, and we're quite aware of that, Medwyn, and we are working in the background to put very different methodologies of managing that, including symptom control, rehabilitation, a lot of interventions there. But I think, let me be clear, I think we acknowledge this challenge, and we're working in the background and taking through F&P our processes to try and manage this in the longer term.
Okay, so Jill, we know that the diagnostic and treatment centres proposals are coming by way of an outline business case to the Finance Performance Committee this month, which is part of the view around how we build long-term sustainability and capacity into the organisation, particularly to deal with planned care. But what we haven't touched upon is unscheduled care. A lot of the indicators in the report around unscheduled care are headed in the wrong direction. Can you just describe what work is going on around unscheduled care, and particularly the point around capacity in our EDs, please?
I can, Mark. Can I just complete planned care, if I may, because you'll know that action's been taken to increase potential theatre capacity in the coming months. We're dropping theatres to address that. Clearly the challenge will be our workforce, but we're putting in place a blended model to try and mitigate that, as well as insourcing diagnostics and other areas, including ophthalmology. In terms of unscheduled care, I would like to bring to the board's attention a proposal that has gone through executive around a plan to improve our unscheduled care performance, working with the Welsh Government Delivery Unit. So Stephen Harris and his team will be supporting us on this, and we're working in the background on what the metrics will look like to go into the plan. But essentially, this is a whole system piece, engaging partners, including Welsh Ambulance, partner local authorities, and looking at the totality of the pathway, including opportunities to intervene. So the Phone First, alongside the 111, which Chris may wish to comment on, ensuring that people have timely access to care, and building on the work that we've seen in terms of the ESDEX and other initiatives that have gone across our sites to ensure that our patients are receiving timely care in our ED departments. We do still have the challenges of the testing and ensuring in managing potential outbreaks that patients are going to the right bed in a timely fashion. But the other element of the plan that we're putting in place is around timely discharge and ensuring that people have options to get to a alternative place of care, preferably their own home, as soon as possible. And that links in to some of the work that we're doing on medically fit, including a conversation, if you will, Mark. We're starting a conversation, I believe it's next week, with area colleagues, with secondary care mental health colleagues, of building on the principles of virtual wards in the community.
And I'll go back to where you started, Mark. It would be remiss of us if we didn't note some of the good performance and improvements that are being made in what is a challenging environment. So we do appreciate and acknowledge the improvements that we can see through the report too. Okay, so I'm going to draw that item to a close there. We note the report, and I'm going to bring us on to finance. So given 8, 9 and 10 in terms of the month reports have all been through Finance Performance Committee, I'm going to ask you to turn your attention to month 10.
Okay, thanks, Chair. So
I'm so sorry, you can take the report as read as well. So okay. Few highlights, please.
Okay, so I think that the highlights to report around the financial position are just around the context. So the Health Board set a plan for a 40 million deficit for the year, and in November the Minister of Health and Social Services announced some strategic support for the Health Board, 51 million this year, and that equates to 40 million around the deficit funding. So this is why we are now able to report a break-even position for the year and year to date. I think the only other significant change to report is around the COVID-19 response at the Health Board. The expenditure incurred and the additional allocation from Welsh Government has meant that this does not have an impact on the position of the reported position. And just in terms of that COVID expenditure, the current position is that we have received 88 million to date, and 151.4 million is the forecast outturn for the COVID expenditure. I think the only other thing I would comment is a savings programme where we had a target this year for 45 million. We have delivered 13.7 million year to date, and we have a forecast now for 17 million, because obviously our ability to deliver savings in the year has been significantly impacted by the COVID-19 pandemic. And of that 17 million, about 11 million is being delivered on a recurrent basis. I think the only thing I'd raise are the commissioner contracts, which are being managed carefully, given that we have a block agreement in place, which has been agreed at a national level with our English providers. And I'm happy to take any questions on the paper and the financial position. Thanks, Chair.
Thanks, Sue. Any questions or observations? One of the items we discussed, Sue, at F&P, it's in the report, is the performance funding for this year.
Yeah.
And the fact that we currently don't have plans for a significant part of that performance funding. Do you just want to give us an update on where you are with that with the team?
Yeah, of course. Thanks, Chair. So we've done quite a lot of work. So remember, this report is at the end of January. We have had good conversations with Welsh Government. Both myself and Joe has been having ongoing discussion, and we are doing everything we can to ensure that we utilise all the funding that we've been given in the year to support both our response to COVID-19 and the performance improvement. And I think we are going to send an accountable officer letter to Welsh Government. We sent one in November to talk about the COVID-19 funding specifically. We're just going to follow that up with another letter so that we are clear about what we're spending the money on and if there's any risk. I think that is reducing because we've done quite a bit of work over the last sort of 6 weeks.
Thanks, Sue. I have no hands up, so we'll take those 3 reports as noted. I think it's worth saying that the plan and the budget is due to come back to board or come to board in the coming weeks, and we've got plans in place to receive and discuss and refine those. So thank you.
Thank you.
So the next item is Medicines Management Annual Report. Kate, I'm not sure whether Berwyn has joined us yet with Louise.
I did, well, on instruction from Llynnos, I told them to join in 10 minutes, which is probably 5 minutes away now. I can email them and say join now, but it literally will take a minute for them to join.
Okay, well, while we're doing that, so I'll come back to that then, Kate. So we'll move on to the Welsh Language Standards Investment and Improvement Report. Fraser.
Diolch i chi, Cadeirydd. Mae'r papur yma o'ch blaen chi heddiw oherwydd oedd hwn yn cwestiwn gath I godi yn un o'n cyfarfodydd o'r blaen ynglyn â'r safona, ac oedden ni'n barod o ran y gwaith. Wedyn mae'r tîm wedi paratoi y papur hwn ar eich cyfer chi mwyn rhoi diweddariad I chi ar lle da ni, yr heria sgynnon ni a'r gwaith sydd yn digwydd. Dwi'n meddwl bod y papur yn hunan esboniadwy, wedyn I ddim I fewn i'r manylion. Ond dwi'n achos gai dweud 1 neu 2 o eiriau ynglyn â beth sydd yn ei le ar hyn o bryd. Wedyn mae'r gwaith sgynnon ni o ran y swyddog cydymffurfio yn helpu ni wneud yn siŵr fod y gwaith yn digwydd. Wrth gwrs mae gynnon ni mecanwaith gweithredu eisoes o fewn y bwr iechyd, a mae gynnon ni grŵp rheoli prosiect sydd yn gweithio'n dda, mae'r rhaid dweud. Mae yna nifer o gwasanaethau yn ffynnu ac yn gwneud gwaith arbennig, mae'n rhaid dweud. Felly mae yna ochr positif I hwn yn barod oherwydd y gwaith da sydd digwydd dros y 2 flynedd dwytha. Swn i'n dweud mae'r her fwyaf I ni gyd ydy'r perchnogaeth o'r gwaith yma o fewn y bwrdd iechyd, a bod pawb yn dallt pwysigrwydd defnyddio'r safona mwyn wneud yn siŵr bod yn gwasanaethau ni'r rhai gorau, rhai fwyaf dwyieithog sy'n bosib ar gyfer yn cleifion a'n poblogaeth ni yma yng Ngogledd Cymru. Wedyn mae gynnon ni enghreiffio eferion da, mae gynnon ni los fawr i'w ddathlu fel da chi'n gwybod, gynnon ni'r cynllun dewis iaith a dwi'n gwybod bod yna llawer o byrddau iechyd yn edrych ar hwnna'n bositif, a mae hwnna'n rhoi'r cynnig rhagweithiol i'n cleifio ni drwy'r amser. Mae gynnon ni waith da yn digwydd hefo primary care, gofal cychwynnol, mae hwnna'n waith pwysig I ni gyd. Ac wrth gwrs, da ni hefyd yn gweithio ar peilot o fewn yr adran iechyd meddwl mwyn bod yn fwy rhagweithiol. Mae hwnna'n bwysig I ni fel bwr iechyd yn arbennig wrth I ni fynd trwy'r gwaith target intervention. A mae'r rhaglen hyfforddiant Gymraeg yn dal I fod yn bwysig, a fel welwch chi'r adroddiad, mae'r gofyn am y gwaith yna wedi bod yn fwy nag oedden ni'n ei ddisgwyl. Dwi'n edrych ymlaen i'r tiwtor newydd dechrau ar ôl gwaith gwych Ceri. Swn i'n dweud ar hyn o bryd I grynhoi felly'r adroddiad, da ni ar hyn o bryd yn monitro'r sefyllfa yn agos iawn. Mae Eifion di gofyn o'r blaen am y gwaith da ni'n wneud, a mae Medwyn fel 5 campwr di bod hefo ni ar y siwrne yma yn trio wneud yn siŵr fod ni'n defnyddio'r safona i'n helpu ni symud ymlaen. Dwi yn teimlo fod ni wedi gwneud cynnydd, mi welwch chi heddiw papur ar bwrdd, y rei sydd yn safonol o ran bob un cyfarfod, mae heina yna ar eich cyfar chi heddiw, a dwi'n ddiolchgar i'r tîm ar draws y bwrdd iechyd I alluogi hynny heddiw. Ond I fi, pan dwi'n edrych ar y papur a mynd yn ôl i'r cwestiwn gath I ofyn gyn John, os dwi'n cofio'n iawn yn y cyfarfod, dwi yn teimlo mae'r her fwyaf ydy'r gwaith da ni'n wneud I wneud yn siŵr bod yna perchnogaeth ar draws y bwrdd iechyd, ac felly y gwaith cynllunio da ni'n wneud. Felly, I grynhoi, mi fyddwn ni dros y 6-9 mis nesaf yma yn wneud yn siŵr fod ni'n dal ati hefo'r gwaith o fewn y tîm, a wedyn nawn ni adrodd yn ôl I chi fel bod angen I wneud yn siŵr fod ni yn wneud y cynnydd a bod ni yn cwrdd ar safona I gyd. Diolch yn iawn I chi.
So I'm going to bring in Avon first. Avion.
Diolch yn fawr, Mr Cadeirydd, diolch yn fawr I Teresa am ei adroddiad, a hefyd am y gwaith arbennig sydd wedi cael ei wneud gyda hi a'r tîm I symud ymlaen a gwella'r sefyllfa'n sylweddol yn ystod y blynyddoedd dwytha. Da ni wedi gweld cynnydd o draws o wahanol safonau a diddolchgar iawn o hynny. Da ni'n gweld hefyd, fel ydych chi'n cyfeirio, Teresa, bod yn adroddiad ni, yr rhaglen ni heddiw, ar gael yn safonol yn y iaith Gymraeg, a dwi'n croesawu hynny, dwi'n siŵr bod ni gyd yn gwneud hynny. Be sydd ddim yn glir yn yr adroddiad, dwi'n meddwl, ydy, be di'r cam nesaf, be sydd angen, pa adnoddau sgynnych chi angen rwan i gyrraedd o safonau i gyd. Mae'n amlwg bod rhai o'r safonau ddim wedi cael eu cyrraedd eto, yn wedig safon 37. So felly, be'n union sydd angen i ni fel bwrdd roed i chi i gyrraedd y safonau mewn amser rhesymol, o chi'n cyfeirio 6 a 9 mis, beth sydd angen ei wneud hynny felly?
Diolch Eifion. Ar hyn o bryd, dwi'n meddwl mae gwaith monitro da ni angen i wneud yn ystod y cyfnod Covid. Da ni wedi gweld y galw am y gwaith cyfieithu ni yn cynyddu yn arbennig, a mae hynna rhywbeth dwi'n falch iawn ohono fo, achos mae hynna'n awgrymu fe na rhywbeth i newid o fewn y bwrdd iechyd, a fod pobl yn dechrau gweld yr angen i bethau fod yn ddwyieithog a'r gwahaniaeth mae'n neud i'r cleifion. Ond dwi'n teimlo fod hi'n rhy gynnar Eifion, da ni'n dysgu wrth fynd, dwi'n poeni am yr galw sy'n yna o ran gwaith y tîm. Da ni wedi gorfod defnyddio tîm allanol mwyn helpu wneud yn siŵr bod ni'n gallu cyfieithu gyd o'r papur ar bwrdd fel enghraifft o fewn yr amserlen sy'n yna. Ond ar hyn o bryd, da ni yn gallu cwrdd ar angen. Wedyn dwi'n teimlo ar hyn o bryd, ac yn enwedig hefo safon 37 Eifion, mae cyfnod monitro sy'n angen i ni dros y 6-9 mis nesaf yma i weld sy'n y pethau'n siclo fewn y bwrdd, i weld os ydy'r cynnydd yma newid, ta ydy'r cynnydd yma mynd i aros efo ni. Mae yna nifer, ydych chi goelio, o arwyddion a papurau llythyrau wedi gorfod cael ei newid o ran Covid. Wedyn dwi angen gweithio fo'r tîm i weld os ydy hwn yn rhywbeth barhaol, ta rhywbeth dros dro. Yr un math efo papurau'r bwrdd, da ni wedi deud fyddwn ni, a mae hwn yn rhan o sgwrs da ni wedi cael Eifion, ydy hyn yn gwneud gwahaniaeth, ydy o'n help oes ne groeso i'r gwaith fel petai a'r gwahaniaeth mae'n neud, ac ydy o'n gweithio i ni i gyd fel bwrdd i helpu cyfathrebu gyda'n poblogaeth ni. Wedyn, ar hyn o bryd, dwi'n meddwl bod gynnau gais arbennig Eifion. Cais dwi'n meddwl swn i'n gofyn i'r bwrdd i, sewch chi weithio hefo ni am y 6 mis nesaf i weld sut mae y cynnydd yn digwydd, a mi fedrwch ni adrodd yn ôl i chi ar y manylder hynny yw, niferoedd o bethau sy'n gorfod cael ei cyfieithu y geiriau fel da ni'n deud. Ond hefyd, dwi'n meddwl, i ni weithio hefo'r tîm o fewn y bwrdd iechyd, oherwydd fod na gofyn, dwi yn teimlo fod angen i'r bwrdd dal yn ambell i le gweithio ar yr ymwybyddiaeth o'r anghenion, dim ond wrthos yma oedd oes ar draws nifer o pamffledi newydd sbon uniaith Saesneg, ac wrth gwrs ddim dyna da ni isio. Ac mae hynna'n dangos i ni fod gynnon ni dal waith i wneud yn siŵr fod bob un swyddog, bob un rheolwr yn deall i gwaith nhw fel petai ac anghenion y safona. Wedyn, swn i'n awgrymu fod ni'n dod yn ôl ato chi mewn rhyw 6-9 mis, ac wrth gwrs drwy'r fforwm mi fyddwn ni yn monitro hyn. A mae yna groeso bob amser i aelodau'r bwrdd ddod i'r fforwm hefyd. Di hynna'n helpu Eifion?
Yndi, dwi'n meddwl bod chi wedi ateb igon teg, ond be sy'n ni licio gwybod ydy, beth ydy agwedd yr Comisiwn yr Iaith i'r cynllun chi? Sy'n ni'n licio gweld y fo'n dod ger bron ac yn deud bod ni ddim yn cyrraedd y safon a wedyn yn rhoi wel, mae yna 5,000 o bunnau fel enghraifft maen nhw'n gallu, yn does. Ond dwi eisiau gwneud siŵr bod ni'n cydweithio hefo'r Comisiwn yr Iaith a bod Aled Roberts rwan yn fodlon y gwaith a'r cynllun sgynnych chi, chi'n sôn am 6 a 9 mis, bod o'n fodlon efo hynny.
Diolch, ac os gai ymateb cadeirydd, i Eifion, dwi'n gwybod fod y comisiynydd yn dŵad i'r bwrdd i cwrdd hefo'r Prif Weithredraig Joe. Wedyn mi fydd yna gyfarfod yn o fuan, a dwi'n edrych ymlaen i'r cyfarfod mwyn gallu dangos y gwaith da sydd yn digwydd, rhannu y pethau da ni'n neud sydd yn arloesi, swn i'n deud ar draws Cymru. Ond dwi hefyd yn ymwybodol bydd o yn herio ni ynglyn â'r gwaith da ni angen i wneud a dal i wneud. Ond ar hyn o bryd dwi yn teimlo fod ni wedi wneud cynnydd da, ond mae yna waith monitro i wneud. Diolch Eifion.
Diolch fawr.
Diolch. Linda?
Diolch yn fawr iawn, a mae Eifion yn rhannol wedi gofyn y cwestiwn o'n i'n mynd i ofyn ynglyn â sut mae hyn i gyd yn cydymffurfio gyda anghenion ni i gyrraedd y safona. Ond yn ychwanegol, ga i ategu yn ddiolchiadau hefyd, ers i mi ddechrau gyda'r Bwrdd Iechyd yn ddiweddar iawn, mae fo'n braf iawn gweld gymaint y dwyieithrwydd sydd rwan gyda papura a dwi yn croesawu nhw. Da chi'n nodi yn eich asesiad, does na ddim cadarnhad ar hyn o bryd ar gyfer y swydd hyfforddi. A eisiau gwybod chydig bach mwy hwyrach, be fydda effaith os bydda Llywodraeth Cymru yn troi lawr neu yn dileu yr gwasanaeth o cefnogi'n ariannol yr swyddog hyfforddi?
Wel, mae'n anodd dweud, Linda, ond dwi yn gwybod fod y gwahaniaeth mae'r tiwtor di wneud bod yn arbennig ar draws Gogledd Cymru ac ar draws y Bwrdd Iechyd. Dwi'n mwysio, o'ch chi yma, Linda, pan nathon ni drafod yr adroddiad blynyddol ar y Gymraeg, ac oedden ni'n dangos y niferoedd sydd yn dysgu ar y gwahanol lefel. Mae gynnon ni bobl yn dechrau o'r newydd, mae gynnon ni feddygon a porthmyn ag ati sy'n wyrach yn rhyw trio gwella i gallu ieithyddol, a mae gynnon ni hefyd pobl sydd yn trio gloiwi iaith fel bod nhw'n gallu gwneud gwaith papur ychydig yn well. Mae gynnon ni bobl ar bob un lefel, a mae hynna wedi cael ei adrodd yn yr adroddiad flynyddol. I fi, mae'r tiwtor wedi bod yn rhywbeth arloesol i ni yng Ngogledd Cymru, wedi gwneud gwahaniaeth, dim ond llynedd tu amser yma llynedd, gathon ni'r noson dathlu dysgwr Gymraeg gyntaf yma yn y Bwrdd Iechyd, noson bron cyn y newidiadau Covid, Linda, dwi'n ei cofio fo'n iawn, oedd y cadeirydd am Edwyn ac cyfeillion hefo ni. Felly, pan dwi'n edrych yn ôl at y noson honno yn yr optig, lle o gynnon ni staff dysgwyr, aelodau sydd yn rhugl yn y Gymraeg, a pawb yn dathlu y cynnydd da ni wedi wneud, fyswn ni'n licio gweld bod ni'n colli'r tiwtor. Wedyn, dwi'n ddiolchgar iawn bod gynnon ni'r tiwtor, dwi'n ddiolchgar iawn bod ni'n gallu cael rhywfaint o gefnogaeth i helpu'r tiwtor a'r gwaith sy'n cael ei wneud gyn aelod arall yn y tîm. Swn i'n hoffi gweld hwnna yn rhan rhywbeth sydd yn y tîm go iawn, tymor hir, ond dwi hefyd yn deall fod na anghenion eraill o fewn y tîm a fydd rhaid i mi dangos y gwahaniaeth maen nhw wedi wneud o ran gofal y claf. Wedyn mae hwnna rhywbeth fyddai'n monitro am y flwyddyn nesaf, ac wyrach fyddai yma o'ch blaenau chi ac o flaen y tîm y swyddogion yn edrych am cefnogaeth. Ond ar hyn o bryd, dwi'n falch o ddeud fydd y tiwtor newydd hefo ni, gobeithio rwan yn yr misoedd nesaf yma, i dilyn i fyny gwaith gwych ar ei Ceri wneud hefo ni. Ac hefo reolada'r bwrdd gan fod Ceri wedi bod hefo ni mewn sesiynau. Dwi'n gwybod sy'n anatab chi, Linda, ond dwi'n meddwl mae dyna lle da ni ar hyn o bryd.
Diolch yn fawr iawn, mae hwnna'n cynhwysfawr iawn. Hwyrach rhywbeth i'r bwrdd nodi, mi fydda da chi yn chwilio am gefnogaeth os bysa'r Llywodraeth Cymru hwyrach yn edrych i dileu yr gefnogaeth hynny. Diolch yn fawr iawn, Teresa.
Diolch, Medwyn.
Diolch, Cadeirydd. Ac fel pencampwr, fyswn i'n hoffi diolch i chi, Cadeirydd, fel un sydd wedi bod yn rhyw fath o cenhedwr i ni, a llys genad i ni, a safbwynt o iaith a'ch cefnogaeth chi i'r iaith, dwi'n meddwl bod o'n werthfawr i'r gwasanaeth. Dwi jyst eisiau dyfynnu o'r adroddiad, oherwydd dwi'n meddwl bod hwn yn bwysig, a fyswn i'n hoffi cael hwn yn cyfnodi yn os modd. Na jyst dyfynnu. Mae llwyddiant y Bwrdd Iechyd i symud ymlaen gyda chyflawni'r safonau wedi arwain at Gomisiynydd y Gymraeg yn amlygu'r Bwrdd Iechyd fel esiampl o arfer da, sef example am y ffordd y mae wedi cynllunio ei wasanaethau i gydymffurfio'r safonau. Dwi'n meddwl bod y werth nodi hwnna. Diolch yn fawr.
Diolch, Medwyn.
Look at that. So, Teresa, in keeping with what's been said, so we note the report. If there are any change in circumstances, particularly around capacity, could you cite the board? I'm sure you'll be keeping the executive team up to date as well. But can you also pass on our sincere thanks for the commitment that the team have demonstrated? We note the increased demand, which is really, really welcome, of course, but we're keen to ensure that we have the capability and capacity in place to respond to that demand in keeping with the Welsh language standards. and the expectations of the Commissioner. So please keep us in the loop.
Wrth gwrs, diolch yn fawr.
Diolch yn fawr. So I'm going to bring us back then to the pharmacy reports, because I think Berwyn and Louise are now with us. Berwyn, are you taking this report yourself? And if so, you can assume, Berwyn, that we've read the report, because I certainly have, and there's a lot of good stuff recorded in here. So I'm keen that you highlight anything you wish whilst recognising the report's been read. Thank you.
Diolch Cadeirydd ac i'r bwrdd am y cyfle i gyflwyno adroddiad blynyddol rheoli meddyginiaethau 2021. Diolch hefyd i Louise Aw-Baker am baratoi'r adroddiad ac i'r Prif Weithredwr ac i'r Cyfarwyddwr Meddygol am ei lliwio. Mae'r adroddiad, fel da chi wedi darllen, yn dilyn 3 rhan penodol, sef yn gyntaf yr adolygiad ein perfformiad o fewn adroddiad blynyddol rhagnodi 19-20 grŵp strategol meddyginiaethau Cymru. Mae hwn yn cynnwys elfennau diogelu, stiwardiaeth gwrthwyotig, effeithiolrwydd a hefyd mynediad meddyginiaethau. Ac yn ail, tuedd rhagnodi o fewn gofal eilraidd ac ysbytai gan gynnwys meddyginiaethau gofal cartref a chost uchel, rhai biological, yn ogystal â mynediad i driniaethau newydd nais. Mae yna waith enfawr wrth law i newid y system electroneg eleni yn fferyllfeydd ysbytai y bwrdd, y 2 ohonynt yn ogystal â ysbyty Llandudno a hefyd carchar Berwyn, a mae hynny'n digwydd o'r Gwanwyn. Ac yn ola, ein ymateb fel gwasanaeth i SARS-CoV-2 gan gynnwys y rhaglen frechu, y triniaeth gofal dwys o fewn yr ysbytai, meddyginiaethau gofal diwedd oes, newidiadau polisi, ac hefyd yr ymateb dewr ac enfawr gan ein fferyllfeydd cymunedol a themau gofal cynradd i gynnal gofal arbennig yn ystod y pandemig, sydd hefyd wedi ymddangos yn y wasg ac wrth gwrs wedi cadw'r drysa yn agored ers Gwanwyn dwytha. Diolch yn fawr, Cadeirydd.
Diolch, Berwyn. So I've got Gareth first of all. He wants to answer a question, I think. Gareth.
Yes, thank you for the report, Berwyn. Just a couple of questions, really, a couple of quick questions. First one is on the patient safety indicator information you've given us around antipsychotics in the over 65s in the report. I just wondered, looking at the information that's in there, it's a bit of a mixed picture in terms of performance, I guess, on that aspect. So we seem to perform well against some of our peers, but overall the trend is up. And as the narrative in the report indicates, there is a UK drive to try and decrease the numbers and the usage of antipsychotics. And you will know, I'm sure, as will others, that that was also a recommendation in the HASCAS report in 2018. So I just wondered if you could comment on that aspect in particular. And then my second question was about procurement, and actually just taking us back to the Brexit issue, which we've largely forgotten about. We were well briefed during that period about potential disruption to supply chain lines and procurement of medicines. I just wondered what the picture is like in terms of a residual risk now that we are in the post-Brexit phase.
Diolch, Gareth. So Louise will answer the first question as our patient safety lead, and I'll pick up the second.
Thank you, Baron, and thank you for your question, Gareth. The first thing I think to note is that North Wales does have a particularly elderly population compared to most parts of Wales, and we also have some quite large EMI care homes, so that may skew the data a bit. I did talk about in the report about introducing a tool to support GPs to a decision-making tool. And I guess one of the problems is that with COVID and remote working, we've not had a chance to audit how well that tool's being used. The other thing is that we do have a lack of capacity, particularly pharmacy capacity in mental health services, and that's an area where in other health boards they've been able to support care homes with training packages and also with GPs. So looking at other solutions other than going to antipsychotics for the management of agitation and some of the more challenging behaviours. So I guess in terms of opportunities, looking ahead, we, as you will have seen in the paper, one of the plans is that if we can't work very closely or work in GPs, one of the opportunities we're looking at is working very closely with care homes. And so we can start to look at how these tools are being used and reviewing patients who are antipsychotics and getting them reviewed effectively. And also, I think there is talk of some opportunities of further investment in pharmacy and mental health, and that further will help us with that. So I hope that answers your question.
Diolch, Louise. I'll take this one in English, Gareth, as far as response to your procurement question around EU exit in particular. And as we have seen during 2020 and into this current year, that in the first wave, we had some very challenging, the dichotomy between EU exit along with COVID meant that it created an instability around the supply chain. And we saw this predominantly within critical care. We were able to mitigate that by best endeavours with mutual aid nationally. And we did clearly observe times when North Wales did supply our allocation of medicines to the south. And indeed, in this second wave, we've actually had the reverse happen. So where we see the wave and the incidents, in particular around COVID, increasing, we've actually now seen the deployment of those pharmaceuticals. There are some still outstanding areas we're working through. Radiopharmaceuticals by nature decay, and as they enter the country from the Netherlands, then clearly they are decaying during transport. And so there is now, certainly Welsh Government support to push forward into our 5-year programme around aspects that will benefit centralisation of services such as radiopharmaceuticals within our board, and that will enable us then to capitalise on when supply chains do become challenged. That centralisation, I think, will help some of those aspects, Gareth. We are very much in steady state as we speak around supply chains with no significant concerns at this stage.
Lucy now wants to come in. Lucy.
Thank you, Chair. First of all, Berwyn, I just wanted to extend my thanks to you and your team for the amazing effort that you've put in during the pandemic. Yeah, I do appreciate you've had some real challenges in relation to trying to manage the vaccine, the distribution, and some of the more nuanced challenges across both primary and secondary care. So thanks very much for that. I know you've also been working your socks off over it, so very much appreciated. In relation to your report, I have to say I was really disappointed with the slow progress in Wales regarding an electronic prescribing system. For this to have been highlighted by the Welsh Government in 2015 as the highest priority for health and care, and here we are in 2021 and we still don't have one. In comparison, our patients over in England have got a first-class service that has been in operation for a number of years now. I mean, you've indicated in the report that this is a patient safety issue. It's not just a matter of convenience that it's easier to, order your scripts through this. It is a significant patient safety issue. So I'm really concerned and feel that Welsh patients are being let down. I have raised this myself with Welsh Government as well. So absolutely welcome and support this being a priority for the Health Board. But I just wondered if you could just briefly explain what the proposal is for the Health Board, how it would work. Are we talking about a primary and secondary care system here, or so if you could help, thank you.
Will do. Thank you, Lucy. So I guess where we are at the moment is that we did present a business case to Welsh Government, which their advice was to separate electronic prescribing and medicines administration away from the replacement of the hospital pharmacy system. So we're doing in a two-step approach. I mentioned in the report and earlier in my introduction that the pharmacy system therefore is being replaced now in the spring with the support of NWIS, and that will be across 5 sites across North Wales. Now by summer, that will be complete, that implementation. That is switching off a very archaic legacy system, stock management system that we've had in pharmacy and secondary care for decades, with a modern system. And that is imperative because you need a robust modern pharmacy system in order to communicate and plug into an electronic prescribing system. So if we'd done the former, the EPMA would not have actually been able to communicate with what was our legacy system. We had to replace that first. So in the architecture, we're doing that currently. And then I share your same frustration and anxiety in your leadership around this, Lucy. So I was really, really encouraged by Cardiff and Vale, where they reported back at our chief pharmacist meeting last week, where they've now been clearly very ambitious around this EPMA agenda. They have liaised with Welsh Government, and it's now been agreed that Cardiff and Vale can now progress a single procurement of EPMA that allows local implementation. So single procurement for Wales that plays for club, region and country with local implementation, which I'm sure our health board will welcome. The next step is that they've now progressed to a procurement notice to invite expressions of interest from the many companies that are out there now in the current market to try and understand what the level of cost is involved and scale. That is now being finalized, and the next step is that that paper will then go to the Medical Directors Board nationally for them to gain their support and sponsorship. We're taking that forward. So we are very much, the Chief Executive of Cardiff and Vale called this in rugby terms a rolling maul, which basically is about pushing the ball forward, but actually other players come in behind to support. And I suspect Betsy and Cardiff and Vale will be moving very much in parallel, Lucy, on this issue. Thank you.
Thanks for that, Diolch yn fawr.
Okay, Joe wants to comment, and then I'll come to John and Cheryl.
Thank you, Chair. Bowen and Louise, thank you for your time today and in your preparation of the report. And to echo Lucy's thanks to you and the entire team with regard to the vaccination programme and COVID-19 preparedness. I was privileged to visit HMP Berwyn last Friday morning, and I was so impressed with the pharmaceutical services that we provide within that setting, managing polypharmacy, delivering drugs safe and effectively in the houses, and management of the central pharmacy were just second to none, and the volume of scripts that are delivered securely and carefully was very impressive. The commitment to multidisciplinary working for a very complex client group was absolutely evident to see, and I wanted just to share those observations at our public meeting, and pleased to ask you to pass on my thanks to your colleagues working in the prison. Diolch yn fawr iawn.
Will do. Thank you, Joe.
Thank you.
John.
Thanks, Mark. I just wanted to follow up on Berwyn's response to Lucy's question in terms of the single procurement of electronic prescribing system. Can you give us assurance that you're involved in the specification of that? Because it's not, the past record of single procurements has missed requirements for ourselves in North Wales in the past, and I'm just wanting to make sure that we are covered in that and we don't end up with a difficulty down the line of having to implement something that doesn't meet the needs that you and your team have got?
Diolch, John. Thank you. Yes, we are, is the answer. Cardiff and Vale and ourselves have been working very much together on this issue. I think the ambition and the desire in both our health boards is there, and with clearly an ambition now to take that forward on a collaborative basis, John. So I can assure you that we're doing that, very much supporting Cardiff as a lead, but actually we're very much alongside them in that procurement exercise.
Okay, great. Thank you very much.
Yeah, Cheryl.
Thank you very much, Chair. I just wanted to actually thank Berwyn and the team about the work they have done over the last 12 months in palliative care for our cancer patients in their own home. I speak to and meet with a lot of these affected families, and the work has been absolutely invaluable in the worst times of their lives. So I'd just like to say thank you on behalf of the families, their carers. Thank you.
Thank you, Cheryl.
Thanks, Cheryl. Berwyn, a couple of questions from me. So the first is, the report refers to a loss of focus in terms of primary care prescribing, and the fact that the response to that is being picked up by a group, but there are concerns about long-term implications of that loss of focus. So some further information, Berwyn, about how concerned you are with that, and the response, I think, would be helpful. And it'll come as no surprise, we're starting to see that play out in terms of budgets as well. So it's clearly a financial cost. Then the second question for me is, so there are clearly areas in the patient safety indicators where we are comparing really well. There's a couple where we're not. Some assurance from you that the couple where we're not, and I think we covered one through Gareth's questions, for example, would be helpful, I think, at this point.
Thank you, Chairman. If I come in first, and then if Louise may want to come in as well, as the lead in this area. So on the primary care engagement, clearly the focus has been very much, as we all know, on the pandemic. I think we've got to the stage now that we are reaching a degree of, dare I call it, steady state, whereby we're obviously trying to move in parallel our response to that, along with clearly managing and supporting primary care with chronic conditions, acute illness, and so forth. What we're working on is that modelling around, first and foremost, cluster engagement and supporting those clusters with our teams. We've clearly utilised technology with remote consultations and so forth, but the focus is I would say, and I'm just looking here at a reference which is Atul Gawande being mortal, is around how do we in effect go forward with managing frailty as a key focus over the coming year, supporting people in their communities and indeed reducing their frailty, because as we know, the more medicines people are prescribed, the increased frailty that occurs. So that's a key focus for us going forward across the entire region over the coming 6 to 12 months, and indeed underpinning that with better effective management of chronic conditions and getting tough on areas such as hypertension and so forth. And clearly that does then play into the clinical effectiveness agenda to ensure that by optimizing the medicines, that indeed will then have an impact downstream on costs of medicines and indeed on budgetary pressures. On the indicators, Louise, are you happy to take that one?
Yes, I'm happy to take that. With the indicators, I think I made reference certainly to one of them in under the beta blockers in asthma, and one of the issues we had, and this was when I was chair of the Wales Prescribing Advisory Group, was that we were trying to, there is a need to work with NWIS, the primary care NWIS, to allow GPs to exception report patients, which would make a difference. And that affects other indicators as well, where patients have been reviewed and it's been it has been deemed that it is right for them to be on either that combination of drugs or that particular medicine, and so there needs to be a way to exception report those so that those patients or those numbers don't come out in the graphs, if you like. So that work was being discussed, but obviously this report, we're now a year on from this report being published almost, and the work has been suspended because of COVID. So we need to make sure that's being picked up. But in terms of, I've described what we're going to do with the antipsychotics, and again, with some of the other work, a lot of it will come out with the frailty work that Beren has just described. I hope that answers your question.
Yes, thank you. Thanks both. So let me conclude by saying, of course, I echo what Joe and Lucy have said, but I think in particular, this report demonstrates the flexibility and the innovation you and your teams have displayed during this difficult period. And to see over the long term that home care has increased by 151% since 2013, I think is really commendable. And that, of course, plays really into the heart of some of our priorities as a board. So thank you for that. And on a personal level, Bowen, can I thank you for the interviews you carried out in Cwmbrai, because I think you come across really, really well as a advocate and a representative of the board, like so many of your colleagues in senior and frontline positions. And the fact that you've been able to represent us in Welsh has been really, really important. So thank you on a personal level for that as well. I'll stop there. We're asked to note 4 things in terms of this report. Our colleagues happy to do so?
Yes.
Yep.
Okay, thank you. So thanks, Berwyn. Thanks, Louise. So I'm going to call a break now for board. I'm conscious of the fact we are running behind, but we need a break. So can I suggest we come back at 25 past, please?
Thank you.
Okay, thanks. Okay, so let's resume the Health Board. If I may, the next item is the Hascas and Ockenden Improvement Recall paper. Jill, are you able to fill this paper, please?
I am, thank you, Chair. First of all, can I just put some context around this? This group was set up after the publication of the Hascas and Ockenden reports, taking each of the suggested improvements, having task force to deliver against the ask on those and to provide progress and oversight via this group. What I would like to say is a significant amount of progress has been made. However, although we are recommending the closure of this group, I would like to make it clear that there will be significant oversight on a number of areas. And as per Lucy's feedback from the Quality Safety Experience Committee, the suggestion is when this was discussed, the principle was discussed in the public part of QSE, that follow-up reports to ensure that the ones that are demonstrated as achieved are maintaining their assurance. What I also like to pick out is there are a number of areas where that have been discussed with the CHC, not least the wider engagement piece. And the CHC, I'd like to thank them for their support in providing safe space events for that wider engagement piece, not only in older people's mental health, but across the suite of services that are offered for the Health Board from mental health. And we've just received some early reports on those, and we will be responding to them and continuing this as part of our engagement. I'd also like to point out, and it is within the document, but it's not clear within the recommendations, that I'd like the board to note that engagement, governance and mental health still sit within targeted intervention and are being led by executive SROs through the targeted intervention and the maturity matrix proposal. So they will still be subject to considerable scrutiny by the board and indeed by Welsh Government. So assuming that people have read the report, what I would like to ask, as the recommendations are, that the board notes the current status of the Ockenden and Hascas recommendations, that the stakeholder engagement across wider mental health and learning disability has actually commenced with Community Health Council support, and I'd like to reiterate the thanks to them for arranging that, and confirmation that the governance arrangements will continue via the committees associated to the boards.
Thanks very much.
Happy to take any questions.
I think Lucy wants to come in first. Lucy.
Thanks very much. Just really to support what Jill said there, the purpose of closing the improvement group is certainly not to move the focus away from the recommendations or any further actions that need to be taken. The improvement group's been running for some time now, and as happens frequently in the health service, things have moved on as services progress. So the purpose as well of behind closing down the improvement group was very much moving it into mainstream work, rather than this being looked at as a separate group. As Jill said, it will still be subject to scrutiny and follow-up, and in fact internal audit will also be doing some independent assurance reviews of it to make sure that the actions have indeed been fully embedded. Thanks.
Okay, I think too, as well as acknowledging the role of the CHC, Jill, we ought to very much acknowledge the role that others have played in the stakeholder group, patients, their families, and so on and so forth. Yeah,
I would absolutely agree with that, Mark. And one of the conversations that we had was to ensure that we heard those voices and continued. And can I not just say thank you for those people that have engaged in the stakeholder group. I'd like to go further than that, Mark, because they have actually contributed to the moving forward of our services and engaged way beyond the group itself. And that has been fantastic. I know it's work that the mental health team are looking to expand upon and to continue. So thank you, Mark. You're absolutely right. There was a plethora of individuals that gave up their time, and I would say under very difficult personal circumstances, because they were living a personal journey, which made it even more incredibly difficult. I also think that beholds us, if it will, to continue to listen to those voices and widen that experience.
Yeah, thanks, Jill. And I think your point around the progress required around mental health is far from over, and that's why it's in the targeted intervention framework. It's a very important one. Thank you. So without further ado, Jill has highlighted the 3 points that we're asked to note. Are colleagues happy to note those 3 points?
Yes.
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 Yeah.
Thank you. Thanks, Jill. So we will now move on to the socio-economic duty briefing. Sue, are you going to lead us into this?
Yeah, I will do. Thanks, Mark. So I suppose, and again, conscious of colleagues' time, but I suppose one of the things I wanted to say is, whilst the specific purpose of this individual report is for the board to approve changes to the terms of reference, this is clearly something that is much greater than just changing documentation. I have to say, and I've been doing this quite a long time, and I think this duty, which is in my view much more than a legal duty, is both fundamental to the development of our plans and delivery of our responsibilities, but also timely as we move into the refresh of our strategy and our work to reset and align our people. We will really only meet our duty working with our partners, networks and populations, and I'm sure there will be many opportunities for the board to better build our understanding of the socio-economic impact and opportunities that we have to support members of our population who are more vulnerable and do require additional support or consideration. I think there'll be many more opportunities for that, and indeed the first opportunity that we'll have to broaden our knowledge as a board of directors, and then clearly cascade that through the organisation will be a session with colleagues on the 8th of April. So I would commend the report to you. I would support the recommendations and happy to take any questions.
So I'm conscious of the fact I think Sally's joined us as well. So Sally, is there anything you wanted to add to Sue's introduction?
Thank you very much. Really, just to support and recognise really the scope of the work. It is significant, and it's relevant to all functions of the Health Board. We have had a task and finish group, a multidisciplinary group working to prepare in relation to this, and grateful for the support of independent member and equality champion as part of that work. The other point I think important to emphasise is this is the beginning. This work will be ongoing. It's new and we're learning across the public sector. We've been very well supported by the Equality and Human Rights Commission and Welsh Government in terms of our understanding, and we've had the opportunity to work alongside the Socio-Economic Duty Implementation Manager from Welsh Government to influence the development of the guidance, and there's a suite of very, very helpful guidance that's been published.
Thanks, Sally.
Thanks, Sally, too. That's really helpful. I don't have any hands up. So, unless Lucy, unless your hand is up now, is it?
No, sorry.
Right, Joe, I think you've just raised your hand.
I have, yes. Thank you, Chair. I had the pleasure of meeting with Sally and Kamala a week or so ago to discuss the socio-economic duty. And we talked about the importance of not only the documentation to support colleagues in challenging themselves in their thinking, but also to think about how we can really bring this duty alive. As a large employer in North Wales, we have a real opportunity to think about how we can raise aspiration and provide opportunities for all North Walians. And I'm very excited by the socio-economic duty and want us to see it as a lively living opportunity to improve health and well-being as a consequence of enabling individuals to be aspirational for their jobs and careers. Thank you.
Thanks, Jo. So as Sue has identified, we've got a workshop coming up. We'll return to this topic in some further detail. So in advance of that, we're asked to note this report, the approach being taken, and to approve the recommendation that the terms of reference of our board committees.
Sorry, Mark, Jackie wants to come in.
Oh, I can't see a raised hand. Sorry, that's not. I'm not. Well, okay, Jackie.
Apologies, Mark. I can't find my hand raising function. I just wanted to say thank you to the team. They've worked exceptionally hard and and I don't think the document does them justice in the amount of work that they've done. So I think we ought to acknowledge that it's been a huge amount of work. There's a whole suite of documents on the intranet now that people can access and our staff can access. So just say thank you, Sally, to yourself and the team, if you would. Thank you.
Yeah, so I'll come back again. So we're asked to note progress and approve the recommendation. Are you happy to do so?
Yes.
Yeah.
Yes.
Thank you.
Yes.
Thanks, Sally, for all the hard work, as Jackie has identified, and we look forward to seeing you, no doubt, at the workshop. Thank you. So we'll now move on to the Sport North Wales business case. Teresa.
Diolch yn iawn, Cadeirydd. Dwi'n falch iawn o ddod
Mark, Chair, just to say that I'll be leaving the meeting now because I've declared an interest earlier on. Thank you.
Yes, I'm in the same club, Mark.
I think Llynos is going to put you in the waiting room.
Okay.
I thought that was being done. Right, you are.
Okay, so we don't need to leave.
No, I think you're being put there.
Diolch, Cadeirydd. Thank you. Dwi'n falch iawn o ddod ar adroddiad ar papur a'r gwaith yma o'ch blaen chi fel bwrdd heddiw. Mae wedi cael ei craffu'n yn barod drwy'r Pwyllgor Strategaeth Partneriaethau a Iechyd y Poblogaeth. Ond dwi am ddeud un neu ddau o eiriau, mae hwn yn rhywbeth pwysig iawn i ni yng Ngogledd Cymru. A wrach mae yna rei'n gofyn pam ydym ni'n trafod hwn o fewn y Bwr' Iechyd. Ond wedyn mi atgoffa chi, mae gynnon ni awydd i fod yn un o'r llefydd gorau o ran iechyd y cyhoedd yng Ngogledd Cymru. Da ni eisiau gwella iechyd y cyhoedd yma yng Ngogledd Cymru. Ond y gwirionedd ydy, mae gynnon ni rei o lefelau ucha gordewdra ymysg yn plant ni yng Nghymru, os nad ar draws y wlad i gyd fel petai. Mae gynnon ni hefyd broblem o ran tlodi, da ni'n ymwybodol o hynny. Mae gwaith mae sŵn newydd trafod yn rhywbeth sydd yn hynod bwysig yn y maes yna, ond da ni hefyd yn gwybod mae tlodi yn un o'r achosion pam fod pobl ddim yn gwneud digon, swn i'n dweud, o weithred ymarferol efo'r corff. Da ni hefyd yn gwybod fod yna dros dreian o'r merched sydd yn feichiog yn Gogledd Cymru, hefyd yn o'r dew. Ac os roi un ystadegau olau chi o Sky, mae dros hanner yn poblogaeth ni yn gwneud llai nag un sesiwn o ymarfer corff bob wythnos. Wedyn mae gynnon ni broblem, a da ni angen wneud rhywbeth am hyn. Ond da ni'n gwybod fel Bwr' Iechyd, mae ddim ni ydy'r unig un sydd yn gweithio yn y maes yma, a da ni angen partneriaid i fod yn gweithio yn yr un lle. Ac os rhywbeth, mae nifer o'n partneriaid yn gwneud mwy yn y maes yma yn barod. Ac mae yna bwrdd i bod yn barod, llawer ohonoch chi'n gwybod am Sports Wales, Chwaraeon Cymru yn ei le. Mae hwnna yna yn barod i ni ar draws Gogledd Cymru weithio fo, ond maen nhw wedi ymroi i weithio wahanol ar draws Cymru. A dyma ni'r cyfle i weithio fel rhanbarth o'r newydd ar yr agenda pwysig yma, hefo'n partneriaid. Wedyn mae'r papur yn rhoi manylion yr corff newydd yn y bodoli, partneriaeth chwaraeon Gogledd Cymru, Sports North Wales, o'n mae'n cael ei adnabod. Da ni fel Bwr' Iechyd wedi bod yn rhan o'r siwrne ers 2019, wedi bod yna yn y cyfarfod cyntaf, dal yna rwan, a da ni yn gweld hwn yn rhywbeth sy'n arloesol. Mae yna gyfle fan hyn i ni gobeithio dod â arian fwy i'r Gogledd, ond hefyd i wneud yn siŵr bod ni'n defnyddio'r arian yna i edrych ar anghenion y poblogaeth a cynnig cyfleoedd newydd o ran ymarfer corff sydd yn addas ar gyfer y poblogaeth ni. Di pawb ddim eisiau gweithio lycra, di pawb ddim eisiau bod yn jogio rownd y bloc. Da ni angen neud pethau sydd yn syml ac yn hawdd ar gyfer y poblogaeth ni. A i ddim fewn i'r manylion, mae'r gwaith papur yn y bwndal i chi. Heddiw, mae yna gyfle i ni cefnogi'r gwaith yma, a dwi'n gofyn i chi fel bwrdd felly, cymeradwyo y sefydlu'r partneriaeth chwaraeon Gogledd Cymru, mi welwch chi enwa y partneriaid eraill o fewn y gwaith papur. Mae hwn yn rhywbeth dwi'n gweld fel rhan o'n gwaith partneriaid y draws Gogledd Cymru. Ac hefyd cytuno fod ni fel bwrdd iechyd yn partner o fewn y partneriaeth hynod pwysig arloesol y cyntaf yma yng Nghymru. A dwi'n gweld fydd rhanbarthau eraill o Cymru yn dilyn ni o fewn amser. Bodlon cymryd cwestiynau, diolch i chi.
Diolch yn fawr, Teresa. Any questions? Nikki.
Thank you, Chair. So I'm very pleased to see the regional approach to this initiative and the business case being brought forward to the board. It is a vitally important agenda from the perspective of prevention, rehabilitation, also quality of life. I note this is for decision rather than for discussion, but I do just have one question, Teresa, for you. In the cover sheet that was attached with the business case, it talks about the focus being on outcomes rather than throughputs. And one issue is that with local authorities and Sport Wales, the outputs tend to be, for example, footfall through leisure centres, that side of things, rather than the actual behavioural change aspects that are so important if we are going to deliver on the ambition of this business case. So I just wondered, in your meetings around this business case, is there an acknowledgement of the importance of the behavioural change component to this, and will it be considered as you move forward?
Good question. I'll try and answer in English this time. Yes, I believe so. I think that there's a different commitment coming through this work, and that's partly the reason for having a regional partnership on this, so we can influence the agenda. And I believe that the aim from Sports Wales, from Sports North Wales going forward, is to have a new ambitious agenda, which is about nurturing and supporting physical activity in a different way. And part of that discussion has been about outcomes. So many people around the table will be aware of Sports Wales, and they've had a very sports, dare I say, focus in the past. And what we now need is more of a sports, get moving, get physically active approach. And that links to a number of outcomes across the region. Whether you sit from a health board perspective or local authority perspective, they are population health outcomes. I do feel that from day one, that was part of our incentive here in North Wales to work differently. And I look forward to working with partners. I believe that this will bring us new opportunities to work together differently as partners, and also to influence the agenda going forward. So hopefully, maybe there's a model here for other partnerships in the region with a governance board and the partnership board.
That's fantastic, and I'm sure you will do this, but if a decision is made to approve the business case and it goes forward in Welsh Government, it's just to make sure that the progress continues to get surfaced, because often the physical activity and sport gender falls to the bottom of the list.
Yes.
Yeah. Adrian, next.
Thank you. Thanks, Teresa, for bringing the paper. Very supportive of this. I'm sure that board members or some board members won't know that a few years ago we achieved the National Award for our partnership with Disability Sports Wales, led in North Wales, improving access and opportunity for people. I mean, subsequently that's been adopted across Wales. I think that clearly demonstrates the ethos of our teams and the benefits that this would bring to many members of our local communities and across our population. So we're supportive of this, definitely.
Thank you.
Thanks, Adrian. Linda?
Diolch yn fawr iawn, Cadeirydd. A dwi'n hollol gefnogol o'r cais yma. Dwi'n cytuno'n llwyr efo Teresa pryd mae'n deud mae'n arloesol a mae hefyd yn rhoi cyfleoedd i'r Bwrdd Iechyd cydweithio mewn partneriaeth. Ond i dim ond eisiau gofyn, a dwi'n gwybod bod yr ymrwymiad am 5 mlynedd, ond wrth gwrs mae canolfannau hamdden wedi bod mewn trafferth ariannol yn ddiweddar ac yn amlwg ar ôl y pandemig mi fydd na bwysau ariannol ar awdurdodau lleol. Oes yna ryw ymrwymiad pe bai yr aelodau enwedig wrach awdurdodau lleol yn methu ymrwymo ar gyfer y 5 mlynedd cyfan? Be fysa'r ymrwymiad y Bwrdd Iechyd i parhau gyda'r partneriaeth? Neu oes na gost ychwanegol ariannol yn cael ei rhagweld pe bai yr rhai o'r aelodau yn methu parhau i gyfrannu yn ariannol lle?
Cwestiwn da, dyd y gwir, Linda, o beth da ni wedi trafod. Da ni'n gweld o'n sector fregus iawn, chwarae teg i bawb, ond da ni'n gweld cyfle fan hyn wrach i atgyfnerthu'r sector. Yn barod, da ni'n gwybod trwy'r gwaith da ni wedi wneud yng Ngogledd Cymru mewn partneriaeth cyn i hyn i gyd dechrau. Let's get moving, mae pobl yn ymwybodol o'r rhaglen yna o waith. Mae hwnna wedi helpu rei o'r sectorau i cael fwy o arian oherwydd fod yna gwaith rhanbarthol yn digwydd a mae'r partneriaeth hefo'r arian yn gweld hwnna'n rhywbeth positif. Be fyswn i yn gallu dweud o ran y Bwrdd Iechyd ydy, da ni hefyd mewn wneud gwaith arall efo'n canolfannau hamdden drwy'r gwaith ar cadw pwysau'n iach fel petai. Ac eleni, da ni wedi bod yn gweithio'n arbennig o ran trio meddwl i'r dyfodol sut da ni'n helpu'r poblogaeth yma. A mae hynna yn gweithio mewn partneriaeth hefo'r sector hamdden yn unigryw hefo'r deiategwyr. Ydy mae yna waith yn digwydd heblaw am hwn fel partneriaeth, ond dwi'n gweld o'i gyd yn cryfhau gyda'n gilydd da ni yn gryfach, a dwi'n teimlo fod y partneriaeth yma yn rhoi'r cynnig i ni. Mae o'n rhywbeth arloesol wedyn, pwy a wyr lle fyddwn ni ymhen 5 mlynedd, ond dwi'n gobeithio fydden ni mewn lle cryfach o'r herwydd.
Diolch yn fawr iawn. Diolch.
Okay, so that concludes the discussion and observations. So we're asked to note the report and support the recommendation. Are colleagues happy to do that?
Yes.
Yes, absolutely.
Yes.
Yeah, seems a very good initiative to me, Teresa. So thank you very much for bringing that to the table. We now move on to information items. And the first is around the smoke-free regulations. This is for information, Teresa. I haven't had any pre-notification of questions, but I'll just check then whether there are any. Any observations, questions or concerns about this paper?
No.
Okay, so thanks for the paper. We'll note the actions described in it, Teresa, and we look forward to hearing the progress moving forward. The next item is summary of private board business to be reported in public. It's been prepared by Louise. It's there for you to note. Are you happy to note it?
Yes.
Yes.
Okay. So I am now closing the business. The date of the next meeting is the 30th of March, and I hereby exclude the press and the public, and we'll need to dial out and dial back in. So I look forward to seeing you in a moment. Thanks very much to everybody who may have been observing the meeting, but more